Jason, you have the remote script?
I do. Yep, I have it up.
Great.
Some words of advice for everyone. Don't eat a big giant bag of popcorn 10 minutes before you go onto a Zoom meeting where you're going to have to talk.
Okay, I just got the notice from NCTV that we are good to go.
Okay. I will call to order the August 18th Select Board meeting to order. I'm going to go through the remote open meeting law script. We are using Zoom webinar for meetings, which allows for the public to participate in the meeting as an attendee. Attendees must register to participate. The registration link is unique to the meeting. People registered to be an attendee must use their names before they start talking. Otherwise, they will not be allowed to participate. I'm sorry, that's a sign up. Attendees will join in listening mode. They can click in the raise hand button if they want. I would also suggest that anybody who's not speaking, just to turn your videos off. That's easier for everybody and less distracting. The chair will call on those who have raised their hands in the order they are raised. All questions should be directed to the chair. All right, we're going to confirm member access first. Members, when I call your name, please respond in the affirmative. Melissa Murphy.
Here.
Christy Ferrantella.
Here.
Don Holgate.
Here.
Matt Fee.
Here.
And I am here. Thank you. Staff, when I call your name, please respond in the affirmative. Ken Bogrant.
Present.
Nancy Holmes. I saw you, Nancy.
Present.
Libby Gibson.
Here.
Amy Baxter.
Here.
Roberto Santamaria.
Here.
David Gray.
Here.
Brian Turbot.
In attendance.
Let's see. I saw Kamal McCarthy.
Here.
Chris Roberts.
Present.
And I think that's it for town staff. Anticipated speakers. We have, go through here, Gary Langley.
Here.
Thank you, Gary. Mary Longacre.
Good afternoon.
Krista and Charles Lewis. I can see that they're on. Maybe they'll take a minute to say here or present. Okay, that's all set. So this open meeting law, the select board is being conducted remotely pursuant to Chapter 20 of the Acts of 2021. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will feature public comment as previously noted. For Zoom meetings, please note this meeting is being recorded. All attendees are participating by video conference. Please be aware that other folks may be able to see you. Take care not to screenshot. All supporting materials that have been provided members of this board are available on the town's website unless otherwise noted. Ground rules. We are now, I will introduce each speaker on the agenda. After they conclude their remarks, the chair will go down the line of members, inviting each name to provide any comments, questions, or motions. Let's see a couple other things. Each vote will be taking, each vote that we're going to take in this meeting will be conducted by a roll call vote. Okay, that pretty much covers that. And there's no change to the agenda that I know of. Libby, over to you for announcements.
Sorry, one change to the agenda about the harbor regs hearing. Do you want
Okay. I thought we were going to just still talk about it and still move it. We still have to make a motion, right? To move it, not move it, but to postpone it.
Yes, when I spoke with Dawn earlier, I thought the idea was to make an announcement at the acceptance of the agenda that the intent is to continue that hearing to a date certain, which will require a vote, yes, but so that people don't wait
Right.
around for it.
Great.
Okay.
So if anybody's here for the harbor regs, we're going to continue this to a later date and do a little bit more work. Not an open session, so we can get to it. We got a lot of contact not just me, but other board members yesterday and today that they weren't available to come in because it's August, and so instead of going through all that tonight and then postponing it, we were just going to move it to another date and do the work a little bit with the stakeholders.
Thank you. So back to announcements?
Yes.
Okay.
Thanks.
The first one we've already taken care of. The second one, I think, speaks for itself. There are COVID vaccine clinics underway through the town, and there's a full schedule online, and one of them listed there. And the applicant introduction and review applications for vacancy on the Roads and Right-of-Way Committee. And I think the idea is to read the names. Mr. Chair, if you...
Sure. The applicants are David Wunderlich, Campbell Sutton, Bruce Watts, and Rob Rainey.
Thank you. And the next item is some other vacancies just being announced on the Agricultural Commission and the Cannabis Advisory Committee. And we've got two vacancies with, on the Agricultural Commission, there are two vacancies with expirations of 2022 and two with expirations of 2023. On the Cannabis Advisory Committee, there is one vacancy with an expiration of 2022. Thank you, Erica, for showing that, and information is online about those. The next regularly scheduled select board meeting will be September 8th, in keeping with the board's summer schedule. And I think we have a couple of people on. I see Mary Longacre, chair of the Coastal Resilience Advisory Committee, to read a proclamation and get the board's approval of it for Climate Change Awareness Month, which will be the month of September.
Thank you, Libby. With your permission, Mr. Chair, I'll go ahead. This is a proclamation for September 2021 as Climate Change Awareness Month for Nantucket. Whereas the town of Nantucket recognizes that climate change and rising sea levels pose a significant and increasing threat to Nantucket, as outlined in various state and federal scenarios. And whereas the Select Board formed the Coastal Resilience Advisory Committee in part to assist with obtaining community feedback on climate change and sea level rise. And whereas in 2021, the town of Nantucket is nearing completion of its first Coastal Resilience Plan. And whereas the town of Nantucket, through a municipal vulnerability preparedness grant, developed a Resilient Nantucket toolkit for adapting historic resources for sea level rise. And whereas Acclimate Nantucket provides a platform for public-private partnership between community organizations and the town of Nantucket on issues of resilience and sustainability. And whereas Acclimate partner organizations are hosting a series of educational events in September 2021 that will feature climate change topics. And now jointly, the Coastal Resilience Advisory Committee and Acclimate call upon the Select Board to proclaim September 2021 Climate Change Awareness Month for the town of Nantucket. We, the Select Board of the town of Nantucket in the Commonwealth of Massachusetts, do hereby officially proclaim the month of September 2021 is Climate Change Awareness Month, and do hereby encourage all residents to learn more about the threats of climate change and sea level rise and the planning efforts underway to increase community resilience. Signed this 18th day of August 2021 by Jason Bridges, Chair of the Select Board. And there is additional information about the Coastal Resilience Advisory Committee's meetings and the events that are available for review on Acclimate's website. I will not read all of those links out for you.
Thank you, Mary.
Thank you.
Is there a motion? Thank you, Matt. Second?
Second.
All those in favor by roll call, as I see you, Melissa Murphy,
Aye.
Christy Ferrantella,
Aye.
Don Holgate,
Aye.
Matt Fee.
Aye.
Jason Bridges, aye. That passes unanimously. Thank you, Mary.
Thank you all. And just to reiterate, the public comment and input is very welcome in the coastal resilience plan. The committee meetings are posted as official town meetings, and we're always happy to take input by email to Vince Murphy, vmurphy@nantucket-ma.gov.
Thank you, Mary. Thanks for everything you do.
Next, I was just going to give the board a quick briefing on the USS Nantucket christening and ship launch, which took place on August 7th in Marinette, Wisconsin. Myself, the harbor master, Sheila Lucy, and our public outreach coordinator, Florencia Rulo, attended. And I wanted to show you all, I think you've seen a little bit of this, a quick video. It's very short, but it really shows the full drama of the launch. And some quick information about the ship, the USS Nantucket. It is a littoral command ship, number 27. It's 387.6 feet long. The beam is 57.7 feet. 57.7 feet. The draft is 14.1 feet. The full load displacement is 3,500 metric tons. It has a speed of greater than 40 knots. The core crew is 50. It can accommodate up to 98 sailors. There is a flight deck that is 1.5 times that of traditional service combatants. And it was a fascinating trip. We had a dinner on Friday night where the sponsor of the ship's name, Polly Spencer, gave a brief speech, and some other people from the shipyard and the Navy spoke as well. And it was very important that people from the namesake community be present. So we were glad to be able to do that. The following day, we had what's called the mast stepping in the morning. And that involved the namesake community and others giving small gifts to the ship that go into a small canister that stays with the ship permanently. And we had a variety of items, including a coin that we had made. Others had coins too. I learned all about these coins. They're quite a whole thing. And Polly had a number of gifts, including a tiny lightship basket, a guardian angel, little things like that. We had a mooring permit, which got some good feedback. We told them they can't use it, but they liked having it. It was quite, we told them how very valuable. So don't try to sell it either. And we had them with some other smaller items. We did have some bigger items that just would not fit, like a flag. And I can't even quite remember a couple of other things, but the flag, they said we had a burgee and a flag, and they can both be displayed in this special area that will be on the ship. That's kind of the namesake community area. And also they will be able to fly it during sea trials. So that was pretty neat. And then after the mast stepping, we headed over to the shipyard, which was right across the street, for the christening and the launch. And there were some speeches given. I needed to make one, and some other people from the Navy, again, in the shipyard, and Polly. And then we did all of that. It was a bit smaller than initially planned because of COVID. So everybody was spread out, everybody wore a mask. And a lot of the shipyard people were there, but again, they were distanced out. So then we went outside for the christening, and Polly was up on a big platform where she said a few words, and including what you'll see on the video. And she did the champagne bottle smash and then the launch. And then we pretty much hung around a bit for photos and chatting with the crew and others, and came pretty much right back to Nantucket. So I hope this works. You know, I'm not all that technologically oriented, but let me see if I can do this. Can everybody see that?
Yep.
Okay. I'm gonna try to move it along a bit.
I look forward to getting to know the officers of the ship and their crew. I will be an advocate for her continued service and well-being. She has been given the name Nantucket and will always have a home. Thank you to all the many people who have made this possible. Hard work, determination, and commitment. We wouldn't be here if not for that. So let's go christen the USS Nantucket. Thank you.
For the United States of America, I christen thee Nantucket. May God bless all who sail on her forever. Amen.
That was the kind of scary part. From where we were, we couldn't quite see it as dramatic. So it was quite dramatic. They had all those different views of it, and we learned a lot about it. They had to do a side launch at this particular location because of the width of the river. And we were also curious, how does the ship get out of there? And that river leads to Lake Michigan, and there's a series of locks and canals that takes it through the St. Lawrence Seaway, and that gets it out to the ocean. So that is just a little bit of an update on that event. The next step is the commissioning, which probably won't be till 23 or 24 because the ship isn't quite done yet. It probably needs another 9 to 12 months. And then the sea trials take about 18 months. And then the commissioning, which most likely will be in Boston, but we will be well briefed ahead of time because we will have a role in that ceremony as well, which probably is going to be easier for people to get to. So there you go.
Thank you, Libby, for attending. I mean, I know in August it's not easy to leave, and I think one of the things you said to me when you got back was, "I'm so glad we were there," you know, because planning this back in the spring and winter, like, how are you going to leave in August? But so thank you to Florencia, you, and Sheila for going.
Thanks. It was a good time. Next is just the select board announcements and comments if anybody has any of those.
Any comments from the board members in general?
Yeah, thank you, Libby, and everyone for making that trek. That was really wonderful to watch. I noticed that you didn't play us your speech, which I would have loved to have heard, but thank you for representing.
I will send it to you guys.
Great. I would love to see it. Thank you again.
Jason, I've got a quick comment. I'll do my bike thing again. I've had another employee hit by a bike, hit by a car on her bicycle. It wasn't an electric bike. She had not worked for us yet. She was due to start in a day or two. She might start tomorrow. She spent 2 nights in the hospital overnight with internal bleeding. And so, you know, you can't make this up. Another girl leaving work 2 days ago was almost hit at North Liberty Street and Cliff Road with a car coming inbound as she was turning, sped up to go past her, and she was within 1.5 feet. And then another employee on the corner of Prospect Street and Atlantic Ave was walking her bike on the sidewalk after having crossed, and someone who ran the stop sign at Atlantic was forced off the road by another car onto the sidewalk and almost hit her. My cousin saw the whole thing happen and almost hit her, drove right up onto the sidewalk. So this is, I've never experienced or heard anything like this before. I'm hearing a lot of stories from people who bike a lot, and I hear it is the craziest, most dangerous year they have experienced. And I've had, like I've said, I've had 3 hits and 2 near misses one hit and 2 near misses in a week, since I talked about this last time. I look at some of this as, sort of a sign, as a warning sign, as a sign to us that something is out of balance, something isn't right. I don't know what to do about it, but I'm just bringing it up for everyone to be careful out there, and for us, as the town fathers, to sort of, not ignore these signs, not ignore what is happening in our community, and instead say, what steps do we have to make it safer for people to bike here, walk here, drive here. I just think, this is, anyway, it's happened, 5 times, like 3 hits and 2 near misses in the course of 5 or 6 weeks is way too much. So I just wanted to bring that up. And my other thought, just for us, and this isn't for tonight, but just to be thinking about, we're going to be doing strategic planning. And I think one of the things that we need to talk about as a board and as a community, we've got our finances in place. I think for the town finances, we've come a long way. We get the financial reports. Maybe we should be thinking about, a personnel report from the various departments. We're seeming to have trouble retaining people, and we seeming to have trouble hiring people and attracting people. I think maybe we should, talk about it when we do our planning and make that a public focus, something that is on at least monthly. I know in my own business, when there's something that is needs attention, that we have to make a special effort to put attention to it. I think as a town, it's something that we need to, sort of put some attention on. So hopefully when we start doing that planning, we can all talk about it. And I'm not being critical saying the staff isn't, because I know they are, but what else, I just think as a community, how can we, I'm just trying to plant the seed to how can we put more attention to those needs. There's some stuff that we're trying to do, but you can't do any of it if you don't have staff. You can't do any of it if there's nowhere for them to live and other aspects. So how do we, let's find a way to put that on top of the, priority list. So those are my 2 thoughts for tonight. Thank you.
Thanks, Matt. Any other comments from board members? Okay. Seeing none, is there any follow-up from comments from prior select board meetings, Libby?
I do not have any, no.
Okay, thank you. Is there any public comment tonight on a subject matter that's not on the agenda? Bill Greeter, he did reach out to me, said he was going to speak during this public comment, so we can go to Bill.
I believe I successfully unmuted myself.
Yeah.
Thank you. Thank you, Mr. Chairman, for taking my comment as well as my question. The phrase, "this just didn't happen overnight," certainly describes the multiple problem areas that we as a community are now facing. Deteriorated roadways, sidewalks, and streets, routine traffic gridlock, record pumping of town water, affordable housing shortage, insufficient space within our town buildings, extensive sewer distribution repairs, airport service issues, and urgent landfill decisions, just to name a few. Last week, I read that the planners on our sister island, along with the U.S. Army Corps of Engineers, are considering a carrying capacity study for Martha's Vineyard. And according to that report, the study would holistically examine current infrastructure and potential build-out, showing how factors such as wastewater, supply chain needs, energy use, erosion, housing, and more, how that will eventually determine the carrying capacity of the vineyard. In past public meetings on Nantucket, I've heard that a capacity study is no longer a modern planning tool. So I ask, what does the vineyard know that we don't? Since our county commission serves as a select board, regional transit authority, fire and police commissioners, public works board, and sewer commissioners, shouldn't the idea of conducting a carrying capacity study for Nantucket be on the to-do list? If so, when would that be on the agenda? And if not, why not? So I thank you for your time, and I look for the end.
Thank you, Mr. Greeter. Is there any other comments on an item that's not on our agenda tonight? Okay.
Just a quick comment on Mr. Greeter's comment. I think if we wanted to do a capacity study, we may be ahead of the vineyard because of our resiliency. And I was surprised that the Army Corps was spearheading it, but I think that's interesting that they're involved too. And so anyway, I think that we are in pretty good shape. We've done some of the planning. I think it's something that we should consider, and, so, but I think it's the vineyard is sort of has been ahead of us on certain aspects, but it doesn't mean that they will stay there.
Thank you, Matt. Dawn and Libby?
Yeah, I wasn't going to comment because it was a public comment, but since we're talking about it, I think that the terminology is kind of important. We've done the build out analysis, and I believe that the planning department's in the midst of updating that. So I actually think in reality, Nantucket is well ahead of the vineyard between the coastal resiliency and the build out analysis. And that maybe there are some opportunities for us to work together as islands, but just the different terminology between build out and resilience and resiliency planning and this term carrying capacity. I think we are all kind of talking about the same thing.
Thank you, Dawn. Libby?
Sorry, I was just going to mention that the town of Nantucket is involved with the vineyard in the study that Mr. Greeter referred to with the Army Corps and the supply issues. And we have a joint municipal vulnerability grant for that. So we're in the game, I'd say.
Thank you, Libby. Okay, seeing no further public comment, we'll move over to the Dawn.
Sorry, I just got a text from Greg to let us know that we are part of the vineyard and the USACE study. Chuck applied for an MVP grant on this, and he's working on it.
Okay, that was from Greg Tivnan, right?
Yes.
Okay, thank you. Okay, moving on to COVID-19 update.
Hello. So we're going to be probably at the next meeting moving back to the old PowerPoint presentations that I had filed away and hope to never see again. So as of right now, I'm still doing I'll do little by little presentations. So I'm just going to go really quick, share my screen and show the positives. So, no, I don't want people to see my email. Sorry. So where we are right now with the positives is an 10.5% positivity rate for the 7 days. What we're seeing is actually pretty significant cases. You'll always see a dip on the weekends because most of the testing programs are shut down on the weekends. I'll get to that shortly. But as we move along, what we're seeing is even though the sewer report was showing 10 cases per day, what we're seeing is about 20. So we are seeing that. If you watched the Board of Health meeting last week, I talked about a plateau effect that we were seeing in the viral concentration. And what this is telling me is that even though the cases have leveled off, we're not seeing a huge spike in cases. It has definitely plateaued and is holding at around this 20 cases per testing day. And then as we move on, vaccination numbers. So where we are right now, since the town took over vaccinations on Memorial Day weekend, we've given 1,715 doses that are in the MIS program. So it's pretty good. Let me share that breakdown. Right here, what you'll see is with the doses administered, let me zoom in on this again for the people. We've given 284 Johnson & Johnson, 520 new doses, and 911 second doses. So we're doing well moving forward. All in all, we've given 22,188 doses as of Monday. So we're in pretty decent shape. Of all the total doses, the town has done approximately 7.7% of all the total doses in just 2 months, really. So we're really happy to see that. But it moves us on to, sorry, the vacuum is on. What is one of the conversations that we're going to be having is a lot of conversation out there about booster shots. Right now, booster shots are approved for immunocompromised people, and we're going to do as the best we can to accommodate them at our vaccine clinics, which are Sundays from noon to 2, and I think Vivi already made the announcement earlier, and Thursdays from 4:30 to 6:30 out of the First Wave parking lot. So we're looking at then today's recommendations was made that you should get a booster shot after 8 months due to the waning immunity situation. That should be approved by around late September. Early projections show is that 8 months before September was the end of January, early February, which really was a limited vaccination. If you remember, it was mostly limited to healthcare workers and people aged 70 and above. So we're going to see a small trickle of those second doses, of those third doses first, and then we're going to see a full deluge of people showing up. And then also around that same time, we're going to be seeing an approval of, most likely seeing an approval of the Moderna and Pfizer vaccine being approved for children ages 5 to 12. So we should be expecting about another 15 to 20,000 doses that we're going to be looking at, because we're still hitting first dose and second dose people. We're going to be still doing second doses, and then we're going to hit the first dose and second dose of children, as well as the third booster shot doses come late September. So it's going to be pretty taxing on the medical staff. So we're asking now in August to please be patient with the Cottage Hospital and the health department as we move forward in this new world with COVID. We have not received this week's sewer numbers yet, so we're still going off last week. So we should be expecting that hopefully tomorrow, if not Friday. And the last one was 10 cases per day, which we're now seeing closer to 20. As far as testing goes, the PCR testings are still being done at the hospital by appointment. We're trying to see where we can expand that at all. As far as the take-home antigen tests that were being given by the health department that were supplied by the state, we gave out 3,000 of those in about 10 days. And unfortunately, those, unless people self-report them, those don't get reported to us. There is an app that the Binax, that Abbott Labs made specifically for the Binax Now rapid antigen test to allow for reporting, but we haven't been receiving any of those reports. So we are not going to be receiving any more take-home tests from the state, but they are talking about getting us an actual Binax machine, which is the rapid antigen test that you see at the ER that the hospital uses for when emergency cases show up. All right. My squeeze ball. So that rapid antigen test that we will be able to do is on a walk-in test basis or an appointment test basis from our end, just because doing the take-home tests that the state was providing is very not cost-effective. Because what was really happening is we get groups that were taking 10, 12, 20 tests when that wasn't needed. So rather than giving it out like that, have them come here, which is what the state's more willing to take care of. Dental Arts is still providing tests. They're also having a little bit of a logistics issue getting a reagent for the PCR testing. Dan's Pharmacy is no longer providing testing. They mentioned it to us this past week. And then Nantucket Medical Associates over at Nantucket Dermatology, Dr. Koresh's office, is now offering testing as well. We are in the process of looking into the feasibility of getting our own PCR machine. And hopefully ARPA funding will be able to take care of that because PCR machines are not cheap. The machine itself is at the minimum in the 4 figures, sometimes into the 5 figures. But what makes it really expensive is the reagent to test for COVID-19, which the reagents cost for the cassettes of 98 wells. For the reagents, it costs $13,000 per 1,000 tests. So and they can't just ship it to us. So we're going to be looking at CLIA waivers and looking at that CLIA, CLIA, I forgot what the acronym stands for. It's a laboratory accreditation process. So we're going to look for a CLIA waiver so that we can do that PCR here. As far as the masks are going, they do seem, by and large, people are paying attention. You will always get people who are going to tell you, mind your own business, it's my right, things like that. Don't get confrontational with them. And for everyone watching at home as well, don't get confrontational with people. It's not worth it. It's not worth violence. It's not worth your own stress levels. Move on. What we are seeing is that most businesses are doing very well at policing masks when they get in. And the same people that are arguing about business rights are actually paying attention because businesses are saying, you have to wear a mask now to come in, the no mask, no shirt, no shoes, no service. And people are, by and large, accessing that. We do hear complaints about the boats. We do hear complaints about, areas of congregation, but it's the same general Pareto rule, the 80-20 rule. 80% of the people will comply, 20%. We're going to spend most of our time tracking down those last 20%. Focus on the good. Don't go out there looking for the mask list, because if you're only focusing on the bad, you're not going to see how well the town is doing as far as masks go. Then let me see what else we're going. There's a Board of Health meeting tomorrow. It's a general monthly meeting, but we are going to be talking about the mask orders, the emergency orders, because hopefully we should have the sewer numbers. And with that, I shall shut up. I've spoken too much and give you all time.
Any comments or questions for Roberto? Matt? And Christy?
Yeah, one question, Roberto. Is there a PCR machine that doesn't require reagent? Is there one from Illinois or somewhere that doesn't require that? Did I hear that from somewhere?
I do not know of any PCR test that doesn't require reagents. They all require some level of a promoter so that they can fingerprint what the DNA is. That's how PCR works. They take a specific area of the DNA that they're trying to find a fingerprint, and then they amplify it per cycle. So you may have heard over the course of the last year and a half, a lot of people complaining about what the cycle threshold was. When people argue about cycle thresholds, if they aren't actual scientists who have used the PCR machine, I can guarantee you 99 times out of 100, they don't know what they're talking about. What a cycle threshold is that every time the PCR machine does a cycle of amplification for that DNA, it doubles the amount of that DNA that's there. So the lower the cycle the lower the cycle number, the higher the concentration of that DNA is in the solution. But you need a reagent, some level of, like a drop of that DNA that you're looking for in that, for lack of a better word, like a primordial soup in that PCR fluid. And that's what's expensive. That little bottle of promoter is what's incredibly expensive.
Christy?
Thanks. I just had a few questions. With the vaccines having to ramp up in the fall with the potential booster shot, is that something that the town would be coordinating, or would we go back to the hospital, or is that going to be a mixture?
We're hoping to now collaborate with both. I have a meeting with the hospital tomorrow morning. Heather, Jericho, and I are meeting with Gary, Dr. Pearl, and I forgot the name of the other person we were going to meet with to talk about the feasibility of where we're going with these boosters, because as COVID becomes more normalized in the population of the United States, it's going to turn more into a seasonal vaccine, kind of like the flu, which will typically be done at a flu clinic or at your primary care clinic. We just need to start looking into the logistics of that. But we're not planning on being able to do it all ourselves. I don't want to burn out my staff.
Okay.
For example, on Sunday, we gave 142 doses in 2 hours using only 3 injectors and 2 volunteers.
Wow. Thank you to the volunteers for that.
Yeah, no, one of them's on here. I think Mary Longacre. I think she already turned off. Yeah, no, the volunteers have been tremendous at helping this happen. Without the volunteers, we don't have a vaccine clinic.
And around testing, I know that the state won't be sending more at-home tests. And I know we've been talking about it a lot the past couple months. Is there any word on maybe a mobile unit as we get into fall and there might be more opportunities for housing?
The mobile unit is a lot harder because they're contracting with a ambulance company. So getting that ambulance out here, getting those people out here, it's not just a one-day thing. That'll be multiple days, which means we now have to find them places to stay, get them food, things like that. So the feasibility of a mobile unit coming down from the state to any of the islands is dwindling by day, every day. Every time we ask, it gets dodged a little bit more, which tells us that there is probably, the silence tells us our answer.
Yeah, I think it's frustrating. I'm sure the fellow board members feel that way, that we've kind of been following it since the beginning, that, you know, contact tracing and testing is the best way out of this and to prevent spikes, and then to not have all the available testing that we've had. It's just a disappointment, but I know that we're all doing the best that we can. So anything that we can do to advocate a push at the state level to help send more tests here, I'm sure other board members would want to write a letter of support for that. The last question I had, you mentioned the Board of Health meeting tomorrow. What type of metrics are you guys following to determine when we'll be ready to lift the mask mandate?
Lifting the mask mandate is a different conversation. And I'm still working on that. I can't give you that answer right now. But as far as one of the main metrics we're still looking at is the sewer testing. And at the last meeting, Mary asked me about the R number again, so I have to dust off the cobwebs of that one and really get cranking on those numbers again. But that's probably our 2 main ones.
Okay, thank you.
Thanks, Christy. Melissa?
Thank you so much, Jason. Roberto, I'm just going to echo, and I'm sure you have it too, but Christy's comment and frustration. I think even we were told at the beginning of the summer that should we have some kind of surge in cases, the state was standing ready to be responsive. And I'm not sure if it's, if any letter or anything from this board or the Board of Health would help in that effort, but I do find it very disappointing that they're not even sending more of the rapid tests, and there's no concrete date at which they're going to perhaps maybe send the rapid antigen testing system to us. So I feel a bit left in a lurch by the state and fairly frustrated by that. However, I think the good news is, and I don't know, I didn't hear this in your report, but I know you were giving us a lot of information really quickly. Hospitalizations have remained low, if I'm not mistaken. And we have not had any deaths, thank goodness, from this recent surge. Is that correct?
That's correct. To my last time I spoke with the hospital yesterday, the hospitalization was still very low. It was down to 1, and only a couple transfers over the weekend. So
great. That to me, those are great indicators that vaccination is working and our community is learning to live with COVID successfully as possible at the moment. Regarding the reporting, I know a lot of people have purchased at home rapid tests, either online or at local pharmacies for testing at home. I even got myself some in case we should need them. And I wonder if there's some network or something we could do to help people learn about how to self-report positive cases. I know for some people, if they're testing positive, they're calling their doctor's office and the doctors are telling them the treatment plan, but I'm not sure if the doctors are then reporting those as part of those numbers. And so we're likely missing a lot of positive results because of the advantage of being able to test at home. So I don't know if there's any reasonable effort we could make, even an email address or something for people to self-report their positives to the health department, and if that's something that your team has talked about. Other than that, I have no other comments, but to thank you all for working so hard to get people vaccinated and echo the thanks, not only to the staff, but to the volunteers too.
No, we definitely, if you want to email us at health@nantucket-ma, that is the easiest way to get a hold of us. We are able to put the positive cases into Maven. But with any infectious diseases, there's always a major level of under-reporting. Flu up until now still is in one of the most under-reported diseases in the United States, because most people just get it, stay home, don't say anything. It's on a normal year. This year, these last 2 years, obviously somebody comes down with the sniffles, they go get tested thinking it's COVID. But in a normal year, when a person gets the sniffles, gets sick, gets a cold, they tend to just hopefully stay home, not go to work. That is one thing that I hope will happen out of this COVID thing. Good time off for people. Anyway, if they get sick, they just stay home. They usually don't report it. So flu is usually underreported. We're coming in the 10 years to follow from now. COVID is going to be one of those that's going to be underreported just as badly as flu. Tick-borne illnesses are underreported. For example, you show up to a doctor's office or a physician's office and you say, you show them, I have a bullseye rash. They know exactly what that is. They give you an order of doxycycline, they send you home. They don't even send it to the laboratory because they know it's mine. That never goes into the system. So that's an unreported case of Lyme. So it's very similar. Unfortunately, if people don't want to report their illness to us, we'll never find out.
Jason, could I follow up? Thank you. Thanks, Roberto. I get that. And I think, we're transitioning as a community about what information is the most relevant information. And it strikes me that, and tell me your opinion on this, but having said all of that and the lack of underreporting and the lack of testing available, knowing that there's more COVID here than we can track, we can trace, we can report on, is not then the seriousness of the cases or hospitalizations and deaths, should there be any, the more important information to track at a certain point? And what is the benefit of tracking the positive cases right now?
Benefit of tracking positive cases right now, since we're fighting a new breakout, basically a new disease, is really what was happening. Unless we're tracking specifically the Delta variant, it's not worth it. What's more important to track is hospitalizations and whether or not those people who are hospitalized are vaccinated or unvaccinated. I don't have that information right now. They haven't reported that. That's not reported to me, who is hospitalized, because I don't need to know. But it is reported to the state. So the state does report out those numbers of what is the percentage of vaccinated versus unvaccinated among the hospitalizations and the deaths. And luckily, so far in the state of Massachusetts, 0.0015% of the of the 254 deaths among the vaccinated in the state of Massachusetts only account for 0.0015% of all the vaccinated people. So the vaccine is working the way it was intended to do. Most vaccines out there don't prevent you from getting the illness. They just prevent you from getting severe symptoms.
Yeah, thank you. I think it's just really important as a community we start to maybe not necessarily shift the information that's providing, because I do think it helps us as a community be responsive in terms of masking and social distancing and knowing how to make choices as we are new to learning to live with COVID. But I also think, there's the other half of the narrative, which is really important, that vaccinations are preventing significant illness and death. And that's the most important thing anyone in the community can do to protect themselves and others.
Absolutely. And the vaccination is helping tremendously a lot as well as on the variants. So the vaccination efficacy that we were seeing among the wild type COVID was 95% with Pfizer and Moderna. Even with Delta, that's only dropped it down to 92% with the efficacy. Still a tremendous dampering of case of symptomology and case severity. So really what it comes down to is, as we move forward into this next month, and the vaccine gets approved for youth, and we get a good amount of the youth vaccinated out there, even if it's just 50%, then we really start seeing that risk go down. And we probably, in my opinion, we will see normality show up. We're gonna see COVID cases every year. We're gonna see the Delta variant. We're gonna see the Lambda variant. A few years from now, we'll probably get the Alpha variant come back and be the predominant strain. It's the same thing that happens with flu. One year it's H1N1, one year it's H5N2, one year it's H2N7. Those are all real strains, by the way. They just tend to cycle. And I think COVID will cycle in the same way. And it'll just be the same concept of the seasonal vaccination for what it is that we're seeing.
Christy?
Thank you. I just had one more question. When you mentioned people staying home when they're sick, do we still have island resources available for people who are quarantining, just to kind of ensure people are staying home, people can do grocery shopping for them? And if so, are those listed on the town website still?
Not that I know of, not like we had, not as organized as it was last year. A lot of those programs were done through temporary funding, and a lot of funding has dried up. So not that I know of. I can work with Jericho to see what we can find. But I don't think the well is dry, but at the same time, I don't think it's, producing as much as it used to.
Okay, thank you.
Matt?
I would say, I think it's also helped. The vaccines have also helped with transmission. People who have been vaccinated are way less likely to transmit. And so, I've seen that sort of we had one employee who had it and we isolated him, and, and then we tested his closest contacts at work and in his house, and they were all fine. I don't think they would have been if he hadn't been vaccinated. Who knows? But it just, it was anecdotal with that and a couple others. It is disappointing because I think what that enabled businesses to do, having the option to test, and to do it easily, enable businesses to, sort of isolate their, a couple sick people and keep everybody else safe. And it's also enabled businesses to test people who feel sick to make sure that they're okay. They're not working, but it was, I've talked to a lot of different restaurants and it was very helpful. And, and so I think it is too bad because I do think that helped. And I do think that helped sort of people to realize the seriousness of it and to, put some decent protocols in place to keep their employees safe, keep themselves open and keep the island safe. I think that there's some things that we've done well that probably wouldn't have happened without, those 3,000 tests that we actually had access to. I think we could have seen something even more different. So I am disappointed there. The other thing is sort of a question. The CDC and the Center for Medicare, Medicaid Services, they today, I think someone sent me a link, they're going to be requiring vaccinations anywhere, any nursing homes or facilities that accept Medicare and Medicaid. That's something that they're working on now. And I wonder, has our group discussed that, for our island home or for our employees? And, if we haven't, I think we should be talking about it. And I also really think we should be talking about it because we are self-funded. And so if people are choosing not to be vaccinated, then that's fine. But we have to be very careful because we're all paying if something very severe happens. And so there's, a financial reason and the, protect your coworkers and your community reason. So if I don't know, I'm asking, are we having those discussions as a town? And if not, should we?
Chris Roberts could address the issue of the nursing home. We are well aware of that requirement and preparations have been underway for weeks about that. We have started to have some internal town administration discussion about the wider issue of requiring municipal employee vaccinations. And I would say those discussions are ongoing. They would require some amount of bargaining. And we're been sort of seeing what other towns are doing. So far, there seem to be 2 cities in the state which are requiring, they're mandating vaccines for their municipal employees. And if they, for whatever reason, don't get vaccinated, then they are required to be tested on a regular basis. So we're in the process, I guess I would say, of evaluating that right now. But this is definitely underway. This discussion.
Chris? Sorry, go ahead, Chris.
Hello, everyone. Thank you. Yes, we received that mandate and we were made aware of the national one this morning. We actually had our first discussion with the unions involved today. They're all on board. They understand that it's a necessity, that unless there is a substantiated medical or religious reason, they must get the vaccine. The unions have already proposed how to do this. So I don't think we're going to get any pushback. Thankfully, the staff at our island home, we're already, I believe, at 83 or 85% fully vaccinated anyway. So thankfully for us, it's a single-digit number to get the remaining. Thankfully, the staff at our island home are right on top of this from the beginning, and the unions are in agreement. They understand it has to happen, or there needs to be specific things in place for it not to, for an individual.
Thank you, Chris. I just want to make one comment. Thank you, Matt. Thanks for everybody's comments and questions. Melissa, I really like what you had to say there kind of at the end of trying to shift what we focus on and how we talk about COVID in the sense of like, how do we analyze the data, positive cases, vaccinations, so we can, we're always risk assessing every day, our businesses, our families, do I go here? Do I go do that? So kind of changing that conversation so we can make better decisions, I think is really important. Just shifting it, not discontinuing the importance of positive cases, but, Roberto, what you said, like vaccines don't prevent you from getting it. It just, prevents you from getting really, really sick, and it's working. And so I like what you said there, Melissa, and I've been kind of looking for the words to to describe that shift. And so you said it well. Thank you. Any other comments? Thank you,
I
Roberto.
guess, Jason, I'm sorry. I just wanted to add, if I could, I also had knew some positive people, and I think because the rest of us are not necessarily in lockdown right now, it is a little bit more flexible and easier to help your friends and neighbors out if people are willing. And I think people are less afraid to say that they're positive in a way that they were a year ago or even 6 months ago. It's not as stigmatized. So we're living in a world that's a bit more open and a bit more less fearful. And I think that's the continued trajectory we need to go on, is to, be less fearful of a positive case, and then, also being willing to ask friends and neighbors for help. And Bartlett's is still doing their curbside delivery, which is fabulous because you can just pop your trunk and have your groceries put in there. So I mention all of that to say, I think to Christy's point about volunteers or resources, it probably would be really wonderful, Roberto, if we could have some resource available on the website still for people to find out, if they happen to be alone and positive, where they could get some help. And I know if there's anything I can do to help your team do that, I'm willing to put in some time there. Thank you.
Thanks, Melissa. Anyone else before we move on? Thank you all. That was a good conversation. Thank you. Okay, there's no new business, nothing that I know of. Approval of minutes and payroll warrants and treasury warrants. Is there a motion?
So moved.
Second.
All those in favor by roll call. Matt Fee.
Aye.
Melissa Murphy.
Aye.
Christy Ferrantella.
Aye.
Ron Holgate.
Aye.
Jason Bridges, aye. That passes unanimously. Pending contracts. Libby, anything you wanted to review?
I did want our DEI director, Kamal McCarthy, to briefly review the DEI strategic plan contract. Kamal?
Sure. Should I give the whole DEI update now or just on the strategic plan?
I think just on the strategic plan, and then as soon as the pending contracts are done, I think you can get right into the report.
Sure. So thanks for having me, everyone. And good afternoon, attendees. So one of the things that I was going to report on today in my full written out speech was the DEI strategic plan. So a committee of 7 members reviewed the proposals that were submitted to create a Nantucket-focused diversity, equity, and inclusion strategic plan. The committee included myself, Rachel Day, Assistant Town Manager, Amanda Perry, Human Resources Director, Rebecca Woodley Oliver, Assistant Procurement Officer, Marita Scarlett as a Community Representative, Esmeralda Martinez as a Community Representative, and Vanessa Williams, formerly with the DPW and a NEAT representative. The evaluation process consisted of committee members reviewing the applications, hosting virtual interviews with both applicants, committee discussions on our likes and dislikes about the proposal and interviews, and individual completion of rankings paperwork provided by the Finance Department. The review committee unanimously recommended Tangible Development LLC to create a DEI strategic plan for the town. As a reminder, the plan will include setting short and long-term benchmarks, developing and conducting training workshops for town employees, boards, and committee members, creating a manual for the DEI office, conducting DEI assessments throughout town government, and other scope of work. And that's all I have to report on the plan. Thank you.
Any questions on that pending contract? Melissa, go ahead.
No questions, just a comment. It's a great review group, and I think I'm excited to see this get started. I'm grateful that you guys gave it a thorough review, and really looking forward to getting this off the ground. So thanks to Kamal, and thank you to the volunteers on that group who reviewed that with you.
Thank you, Melissa. Thank you, Kamal. Matt?
Yeah, we're still on contracts, right? Pending
Yep.
on. Yeah, there was claim administration and third-party administration. for the finance department, and I don't recall seeing those before. Is that something new, or those are every year?
Yes, Finance Director Brian, do you want to address that? It's either every year or every 3 years.
Okay,
It's every year.
okay, thanks.
Any other comments or questions on any contracts? If not, can I have a motion? Thank you, Matt.
Second.
All those in favor by roll call, Matt Fee.
Aye.
Melissa Murphy,
Aye.
Christy Ferrantella,
Aye.
Don Hill Holgate.
Aye.
Jason Bridges, aye. That passes unanimously. Thank you. And Libby, are you taking over reports?
Yes, thank you.
Okay.
So first off, we have our DEI director again, Kamal, who's going to give us a report on some of what he's up to these days.
I'm just going to continue. Thanks again, everyone, and give a quick update on what's been going on in DEI office. There are 4 specific things that I'd like to talk about. Really quickly, the first, I guess technically the second on my list, it says the next thing. But in this context, it's the first. The first thing that I'm going to report on is the ongoing lunch and learn sessions. So since the 2nd week of June, I've been leading a book group discussion with department heads on Stephen Young's book titled Micro-Messaging, Why Great Leadership is Beyond Words. The group meets every Thursday to discuss the assigned read-ins and how it relates to their work. The most fruitful part of the discussions has been listening to colleagues learn new information about each other and share ideas on how they can decrease micro inequities and increase micro advantages behaviors. There are 2 book discussions remaining, and ideally this will continue with other town employees. The next thing I want to talk about is that the town is in regards, to the town's participation on the professionalization network for DEI cohorts throughout the Commonwealth. That's just a fancy way for me to say that the Nantucket DEI office is part of the Massachusetts DEI Coalition. This group is made up of DEI professionals, county and city leaders, and towns with DEI committees. I've had the opportunity to attend at least 1 meeting, and the members discuss a lot of different DEI concerns, share ideas, talk about the coalition's relationship with the State House and how to develop that further. I'm looking forward to contributing to the coalition and learning from colleagues there and throughout the Commonwealth. 2 other things to report on. The next one is Indigenous Peoples Day. So I'm working on a brief write-up with the Director of Culture and Tourism to acknowledge Indigenous Peoples Day. At this year's town meeting, a non-binding directive passed to adopt Indigenous Peoples Day locally in place of Columbus Day holiday. The purpose of the article is to acknowledge Nantucket's Wampanoag heritage and provide information on books and locations that share more details about the island's Indigenous past. And then the last thing that I will just let the board know is that the DEI office is launching a pilot initiative called NEET. So NEET stands for the Nantucket Employee Empowerment Team, and it was created to empower employees to recognize and utilize their skills to provide exceptional customer service to the Nantucket community. This was all started before I took on the DEI director role, and by default, all town employees are a member of NEET. The goal of the initiative is to identify and learn about the unsung heroes that work to keep their departments performing well. So starting in September, each month there will be a brief write-up in the town manager's newsletter about 1 employee. The duration of the initiative is until December of this year, but it will continue depending on feedback. And that's all the DEI updates to offer. Any questions?
Any questions for Kamal? Thoughts? I have just on the pending contract we just proposed an RFP. What's the timeline on that? And what's is it 6 months that we're working with tangible development? 3 months?
The timeline as advertised was for 18 months to develop.
18 months. Wow. Okay. And is it, I could probably go look at the RFP, but is it phases? They come in and do assessments and then something's rolled out, and then it goes into the next phase? Just generally,
Correct.
how does
it's
it
in
work?
different phases, yes.
Okay. Great. Thank you.
My pleasure.
Okay, next we've got another report from town administration regarding the R Island home. It's a new facility status report with potential action by the board if you are all ready to do that tonight or not. We just at some point pretty soon, in order to move this project ahead, need to understand what direction we are going in. So there is a presentation. Unfortunately, as we know, or fortunately, as the case may be, actually, our assistant town manager, Rachel Day, who we had hoped would be able to give this report, has had her baby over the weekend. So congratulations to Rachel and the baby. She had a little baby girl, and we're very happy about that. But we do, of course, miss Rachel terribly, but she'll be back. And we're trying to limp along without her. So first up, we've got a project summary for this. If we can go, yep, thank you. Which is just shown here. I won't review it word for word, but obviously we need to renovate or build a new facility due to changes in the industry. The age of the current facility and its existing systems are becoming very problematic. We've been discussing this situation as early as 2007 or since 2007. We've had feasibility studies on 2 locations. One was in 2017, the other in 2019. And I think as the board knows, we had facilitated stakeholder meetings that started in July of 2020 and continued off and on through April of 2021. And you had a report from the facilitator, I believe in April or May, maybe it was even June. Next slide, please. Thank you. Project funding and cost estimates. We have our current appropriation for project planning for our island home is $1 million, which was approved at the 2015 annual town meeting. From the studies that we have done, estimated project costs range for a new facility from about approximately $30 to $43 million, and these estimates have not been updated. And as we know, we have seen significant spikes in the cost of construction with recent projects, so that would need to be factored in. In 2017, SMRT did this small house model potential project, which would have taken place at Sherburne Commons and which would have necessitated the acquisition of private property adjacent to Sherburne Commons. And that was going to cost almost $30,000 at that time. In 2019, we had a different firm, LWDA, who presented 2 options at the current site. And those numbers are listed there. And just as a point of reference, the existing island home is 22,000 square feet. Just a little more detail on the current funding of $1 million. We've spent about $710,000 of that amount, and we have about $289,000 left. Most recent project history is shown here. We had a work group in 2012, which reviewed finances and operations. In July of 2013, that report presented 4 recommendations. Those are in your packet. And I'll just quickly refresh everybody's memory about what those recommendations were at the time. Number 1, develop community-based care that provides skilled nursing services delivered in a home setting. That has had some discussion, but hasn't really progressed to the point of having a program for that. Number 2 was, thank you, Erica, establish or serve as a catalyst for the formation of an entity that would formally coordinate senior services among the many entities now providing some, but not all, of these services on island. That really has not progressed. I would say not at all, unless there's something that I'm not aware of. 3 was beginning planning for a new island home to be located at Sherburne Commons, re-envisioned, smaller, that utilizes the non-medical infrastructure services such as food preparation, laundry, and facilities maintenance currently provided at Sherburne Commons. And I think this is where we are at this point. Those types of services, of course, those are just examples, and those would have yet to be explored. And lastly, sell the land where the island home currently exists to the land bank at fair market value. And I think at this point, the position of the board and administration is we do not propose to sell that property, but rather to repurpose that property for a senior center. So moving on with the project history, again, in April 2015, we secured the funding at the time, which was intended to design a new facility. We had engaged SMRT for a feasibility study of various locations. That study was presented to the board in the fall of 2015. Subsequently, we engaged AK Advisors and Raven Consulting to provide financial analysis and modeling. And they did financial analysis of the operational model that we were looking at using at that point, along with demographics and bed size. Not bed size, number of beds, really, is what that is intended to say. And then we proceeded on. I won't read all of those things. Well, I guess maybe I will just refer to them a little bit. We conducted outreach for the next year and a half or so, and almost 2 years. And in October of 2016, there was a citizen article to formulate a work group on this whole matter. And that progressed. We had a final report from the SK Advisors in January of 2017. Reports were presented in March of 2017. And at the April 2017 annual town meeting, $30 million was proposed for the design and construction, property acquisition, and other associated articles that would be needed to build a new facility adjacent to Sherburne Commons. And I mentioned this just now, that would have required the acquisition of private property, again, next to Sherburne Commons. Those articles were not approved. Later that year, the board voted to engage a firm to basically conduct a what would it take study to build or renovate a new facility at the current site. So that progressed, and we had a number of meetings about this, including a charrette, maybe more than one, to which a number of stakeholders were invited. And that study kind of has sat out there because the price tag on it was pretty significant, in the $40 to $50 million range. And most recently, we engaged our special facilitator, Herb Taylor, who held these stakeholder meetings and presented the final report. Okay, I do have the date of that, was May 26th of this year. And I've had a number of conversations with probably each of you, or you all have had these conversations at public meetings as to how to move this forward, because as we continue not to move forward, the island home continues not to get improved. So the next steps are for the board to determine where we are going to focus our efforts on a new facility. And after the stakeholder meetings, the numerous discussions that have been had for quite a long time, it's the recommendation of the administration to build a new home-like facility, not necessarily this small house or greenhouse model, but most likely a possibly two-story building, which would be located at Sherburne Commons. There are a number of benefits, we believe. Disruption to the residents would be minimized from building a new facility at the current site. There could be potential efficiencies with shared services or shared building space. We would minimize the disruption to the Sherburne Commons area residents with a new access off of South Shore Road, not Maya Comet Road, which was previously proposed. And a big benefit, I think, would be to utilize the current East Creek Road location for a new senior center. And we do hear a lot, probably I guess I would just speak for myself. The biggest concern I hear has to do with the view of the current facility, which of course is amazing. And that view would remain amazing with a senior center there, which the island home residents most certainly could enjoy with programs and perhaps even an adult daycare medical model program at the senior center. It could also be a more public park area that could be set aside out there that the public could have access to. That's a little tricky right at the moment. The access isn't as what it maybe could be at that site. And that, I think, is where we are. Chris, I don't know if you want to add anything that I missed or, oh, I'm sorry, there is more here. Once the board makes this decision, I think additional steps would be to establish a building committee similar to the Nantucket Intermediate School Building Committee, which would have representation could be from any of those groups that are listed. And the charge would be determined, but would include hopefully the items that are listed there. One of the important things we think is probably necessary is to engage a public outreach point of contact to work with our own public outreach coordinator to do regular outreach with groups and with individuals and people about the project, facilitate public meetings to assist with project questions or concerns, things of that nature. And is there one more slide? Oh, there are some other steps. These are just kind of miscellaneous sorts of things that will need to be done as well. Staffing and collective bargaining needs to occur with regard to this project and the model once we've decided on that, the building model, I mean, and what its layout would be, and if there's anything different with respect to the model that we have now. Employee housing is quite possible at this site, so that would need to be part of it. Legal review of the current land lease with Sherburne Commons, and we need to agree with them on the footprint and the specific location and site area, and whether or not there may be grant and or fundraising opportunities for this project. Preliminary timeline could be, and this is by no means written in stone, at the 2022 annual town meeting, we could request funds for design and associated costs for the new facility. Also, we could at the same town meeting request funds for a feasibility study to repurpose the current site for a senior center. And there may be other associated uses there. At the 23, maybe 24 annual town meeting, request construction funds for the new Island Home facility. Whatever the following year is after that, similar funds for design costs once the feasibility study would be done for a new senior center at the current site, design and associated costs for that. And then a year or two later, funds for construction and renovation of that project at the current site for a senior center. Yeah, these are just some candidates here. I would just turn to the administrator and or Melissa or Dawn because they've been very involved in this most recently, if I missed anything or if you want to elaborate on anything.
Anybody? Melissa, Dawn, Chris, go ahead.
I was about to say, me personally, I don't have anything to add. Libby hit all the highlights really good. I think we need to make a move on this because as a town, we've been talking about this since 2007. And for those of you who want a point of reference, that was my freshman year of college to be able to do what I'm doing now. So it's been a long time and these people deserve the upgrade. They deserve, especially after everything they've been through in these last 18 months. This is what they deserve. And I just think we need to do whatever we need to do to move it along and get them the building that they've been waiting for since 2007.
Thank you, Chris. Melissa, Dawn, go ahead.
I couldn't agree with Chris more that it's long overdue to move this forward, but it does, of course, take time to figure out the right path sometimes. And I've heard a lot through all of the stakeholder sessions with Herb and so forth, that there is more of a desire to build a brand new facility if we can repurpose the current site for something that is a use to all seniors and potentially all community members. So there was a lot of mistrust prior in regard to the site being sold, in regard to the new facility maybe becoming privatized, which is not the intention at all here. There were concerned with Maya Comet neighbors that road just really couldn't handle kind of a quasi-commercial type of structure. And I think that we've come up with a general plan that addresses a lot of those big concerns. And the other big hurdle that I hear a lot of, why can't we just rebuild on the current site? And we did come up with a plan where that could be done, but it was still going to require a change in the census of the number of residents that would be there, and it would be extremely disruptive to their quality of life for a number of years. Not to mention, setting aside the cost factor, because that's not necessarily what it is for me. If the community wants to vote to pay for it, it's more the disruption factor, and coming up with a way to preserve that view kind of in perpetuity, for all Nantucket residents to have the benefit of, while getting a very, very overdue new facility built for these residents. Back prior to our surge in the Delta variant, I was visiting the island home on a regular basis, and it's just really, really needs attention. The staff is absolutely amazing, and the residents are generally happy, but the size of the rooms, the bathroom situations are just, they're just so far overdue to have a change. So I obviously want to hear from the other board members, but I'm hoping we can move to a motion to move things forward and get that building committee established so we can really kind of do a road show to get ready for town meeting.
Thank you, Dawn. Well said. Anyone else? Any other comments? Matt?
Yeah, I think it's been a process. I agree, Don, with with everything you've said about replacing the building. I wouldn't want to. The only thing we have to be careful of, I don't think we want to tie our hands with how we're going to operate till we know what we're building and how we should operate. I don't think we should be, that should be explored. Now that we're working on a building, we should be exploring what is the best way for the town to operate this moving forward. It is not easy to operate. It is not, it's very expensive. It's hard to find staff. If there are ways that we can consolidate with Sherburne Commons to, share certain aspects, et cetera, that should be happening. So I think, on a dual track, I'm in favor of, I think it was 3 and 4. I'm in favor of, of putting this forward at Sherburne Commons. I'm in favor of having this be a, having the existing site be some sort of senior center and doing that feasibility. That's all great. I think a dual track, though, is how are we going to, should be operational, and how do we, what do we have to do? What concessions do we have to get for the union, if any? What changes do we have to get? What things do we have to, tackle, and not build a building and then try to do that. That should all be done prior. And so I'm willing to vote for this if I have an understanding that that will all happen.
Thank you, Matt. Christy?
Thank you. I think Dawn touched on a lot of the things that I was thinking as Libby was presenting this. And I think a lot of the public concerns that I've heard over the past couple of years is kind of the quality of life at the island home and the view. And I think Dawn touched on it that, if we were to construct on that site, their quality of life and having to do everything, while they're still there is going to be really difficult. So I see it as a community benefit to have it offsite, and then to preserve that space to have that community benefit of, a senior center, community center, or whatever it may be. It kind of seems like a win-win in this situation. And, it's taken a little while to get there, but I think that we're on the right path.
Thank you, Christy. I would add on to reiterate all of that. And, Libby talked about the view, that it would be preserved. Thinking about that this week, it's not just for the residents, it's also for the community and the family members who have spent weeks, months, years there with their loved ones. Like, that view and that space, that location means a lot. There's a huge emotional connection. So if we're preserving that and those family members have access to it, and the community does, and our senior community will be there with the senior center there, I think it's a home run. And it kind of checks all those boxes. And in what you said, Don, about a lot of the fear, maybe mistrust, and has been worked through over the years. So I'm willing to move forward as well with the motion. Anybody, Don?
I just wanted to touch on Matt's points. I know that that's been kind of an ongoing narrative of making sure that we are also in appropriate shape to continue to operate this facility. And I know that Libby touched on it in her report in the PowerPoint, that there may be some opportunities to have crossover types of services with Sherburne Commons. And that's another real positive in regard to this site. And I think that we will be working parallel tracks for how the facility is going to operate and all of those details, because I mean, also going to 2 stories requires slightly different staffing components. It's also been raised that, you know, the current facility is in a storm surge area, and with rising seas and coastal resiliency. There may be some concern about rebuilding anything on this site, but what I've been talking to people about is in the modeling, it is generally more of a major storm event type of situation that shows as a concern. A new building would obviously be built to new standards, and it seems like a more responsible thing to build something that if there was, say, a hurricane coming, it's a daytime activity place. No one's living there. We don't need an evacuation plan. And I don't think we have quite the same factors on the South Shore Road side of Sherburne Commons. So I just wanted to make those last couple of points. I'd be happy to make a motion to move forward with establishing a building committee through the town manager, and planning to put 2 articles on for the 2022 Springtown meeting for both design of a new facility at Sherburne Commons, as well as a feasibility and preliminary design sketches at the current Island Home site for the senior center, so that those 2 things could also move along on parallel tracks. Does that sound right, Libby?
Yeah, I'll second that.
Don, does that motion cover just that trust factor of knowing that the current site will be repurposed for a senior center? Is that in that motion? Kind of at the end?
To also ask for funding for the feasibility study of the current site on how to reconstruct a senior center.
Okay, all right. I thought you said that. I just wanted to make sure. Any other comments? Okay, all those in favor by roll call. Matt Fee?
Aye.
Melissa Murphy?
Aye.
Christy Ferrantella?
Aye.
Don Holgate?
Aye.
Jason Bridges, aye. That passes unanimously. Thank you, everyone, for the work you've done. Thank you, Chris, Libby, Don, Melissa, and the many, many dozens and dozens of people who have put time into this since 2007. Thank you. Okay, moving on to citizen department request. Town clerk request for appointment of registrar of voters. Nancy?
Thank you, Jason. Good evening, everyone. I think my letter pretty much requesting Mr. Gary Langley be appointed as a registrar explains it all. And I want to thank Gary for being on tonight, because he got called away on a personal matter and he's up in Boston and has a bit of iffy Wi-Fi, but I believe he's still on here. Should you want to ask him anything, or certainly ask me any questions. But the main role, there's different roles for a registrar, but the main thing is that they, or some of the main things, they assist the clerk with the required in-person voter registration sessions that the state requires when we're open after hours, if they're able to, or if they can. And, speaking of the Island Home, our registrars do a very special duty in that they bring the ballots to the Island Home residents, because that is a separate declared polling place for us, so that they can vote there at the home. And one of the most important things that registrars do is something that they almost never do and only have once in the 13 years I've been here, is that they act as judges and certifiers should there ever be any kind of a recount in an election. So I think Gary would be a wonderful addition. He's on the Democratic Town Committee, and I hope you'll approve his nomination.
Move approval.
Comments or motions?
Move approval.
I
Is
just
there a
want to
second?
thank you for nominating me for that, for the registrar position, and I'd be happy to serve in that capacity. Thank you.
Thank you, Gary. It's much appreciated.
Thanks, Gary. Matt made the motion. Who seconded it? It was Don. Okay. All those in favor by roll call. Matt Fee,
Aye.
Melissa Murphy,
Aye.
Christy Ferrantella,
Aye.
Don Holgate,
Aye.
Jason Bridges. Aye. That passes unanimously.
Thank you. Thank you, Gary.
Okay,
Thanks,
thank
Nikki.
you.
Okay, next up, we have a request for waiver of sewer connection permit fee for Covenant Home located at 5 Evergreen Way. Mr. Tucker Holland.
Thank you very much, Mr. Chair. I know you guys have a lot going on tonight, so I'll keep this pretty brief. This is a standard request for waiver of the connection fee for a Covenant Home. Included in the packet are the certification of Linda Town, who is the buyer, as a qualified covenant buyer, as well as for the property itself at 5 Evergreen Way. And I would ask for your approval of this sewer fee connection waiver.
Matt.
Move approval. It fits our policy.
Okay, second by Don. All those in favor by roll call. Christy Ferrantella,
Aye.
Melissa Murphy,
Aye.
Matt Fee,
Aye.
Don Holgate,
Aye.
Jason Bridges, aye. That passes unanimously. Thank you, Tucker.
Just one quick note on covenant programs. The Housing Nantucket just passed their 100th covenant home. So very excited for that program.
Wow, congrats. That's great. Thank you, Christy. All right, on to sewer department. Request for waiver of town noise bylaw for continuation of Shoreside Road sewer improvement projects.
Jason, you skipped number 3.
Okay. We're going to go back to number 3. Request for approval and execution of discharge of housing rehabilitation loan program promissory note for property at 7 Monahasset Road. Sorry, Tucker, I was moving on fast.
No problem at all. I like fast, and I'll make this one fast as well. Thank you, Mr. Chair. So this is another routine item, I would describe it as. The board may recall over the course of the last year or two, you've done similar discharges for a program that was originally implemented about 15 years ago, originally administered by Housing Nantucket, and then at around 2010, the responsibility was transferred over to the town. And basically, this was a forgivable loan program over 15 years for improvements to properties that are year-round residences, so long as the owner remains in the property for the duration of the 15 years. And that is the case here. Sharon Jones and her husband, I believe, have lived in the property the entire time and otherwise complied with all of the requirements of the program. And they are in the process of refinancing the home, even though there is no financial obligation left. This is something that the bank and they would like to have cleared up. So this is a simple discharge. All of the conditions have been met.
Thank you, Tucker. Matt?
Approval.
Second. Second by Melissa. All those in favor by roll call. Don Holgate.
Aye.
Matt Fee.
Aye.
Melissa Murphy.
Aye.
Christy Ferrantella.
Aye.
Jason Bridges, aye. That passes unanimously.
Thank you.
Now, thank you, Tucker. Moving on to number 4. Again, sewer department request for waiver of town noise bylaw for continuation of Surfside Road sewer improvement from September 13th to November 19th. From 4 p.m. to 2 a.m. I think we have David Gray here.
Good evening, everyone. Thank you. This is just so we can move along and finish the roadside piece of the project. They have been working on the pump station all summer. and it's going along great. But this is just to move along. Most likely, we won't be using Sunday nights. We'll only be using Monday through Thursday nights, but we wanted to include the Sunday just in case something came up. So,
Matt,
Move approval.
Second.
any other discussion or questions? Seeing none.
Just a quick comment. Oh, I'm sorry, Libby.
Go ahead.
Go ahead.
I just want to make sure that, any neighborhood rerouting, any of the lessons learned from the last time we did this are put into effect. So good community communication and making sure that as much as possible, it is wrapped up by 2 a.m. because this is really disruptive, obviously, but the work needs to be done. So thanks, David.
be on top of it for you.
I was going to mention something similar, that we have talked internally about the need for really strong public outreach on this, especially with the neighborhoods, and especially to keep advice out there and signage and whatever, that people need not speed through neighborhoods where there may be detours.
Mhm.
That's all.
Okay, I don't see any more comments. Did we have a second? Was that-
Yes, I believe I seconded.
Thank you, Melissa. Okay, all those in favor by roll call, Don Holgate,
Aye.
Matt Fee,
Aye.
Melissa Murphy,
Aye.
Christy Ferrantella,
Aye.
Jason Bridges, aye. That passes unanimously. Thank you, David.
Thank you, everyone. Good night.
Okay, applicant introduction review of applications. Let me pull this up. Okay. So we're going to be appointing today. Are we doing this similar to how we've always done it, Erica? We send you an email?
So what you're going to do today, because we haven't had an interview with the applicants yet, is allow any applicant who is on as an attendee to speak on their applications.
Sure.
So they can review anything and ask, answer any questions you may have. And then once all the reviews are done, then you'll make appointments. I do want to note that Susan Locke and Linda Williams both contacted me. They are unable to attend tonight's hearing. And Janet Forrest has withdrawn her application for Council for Human Services.
Okay. So I guess we'll go through one at a time.
Yeah, we can read the applicant list. And then they can raise their hands if they wish to speak.
Okay, so I'll read the applicants for Council for Human Services. There's 2 seats available, and there was 8 applicants, but 7 now that Janet Forrest has taken her name off. Thank you, Janet, for even applying. So we have Athlon Sweeney, Kelly Steffen, Ruth Danico, Sally Ann Austin, Colin Ferguson, Veronica Bolkick, and Jordan Leiden. So if any of you that I just named would like to speak at all, just raise your hand as attendees and we'll just go down the list. Hi, Veronica. You can let her in there.
Thank you very much for the opportunity to introduce myself to the Select Board and the public who is participating tonight in the meeting. I have been involved with human services basically for my entire professional life and also in my volunteering life. Since 2018, we've been full-time residents on the island, but we've been owners and visitors since 1998 or 99. My firm belief is that to give back to the community, and that's the reason why I seek to volunteer. Nantucket is an extremely special place and a diverse community. Before moving to Nantucket, I lived in New Jersey in a community called Hackensack, who in its makeup is very similar to Nantucket. Our school system had over 100 languages spoken at home. I was on the Board of Education there for 7 years as just one of my volunteer positions. And the diversity of the community was something that I embraced and celebrated. And I think most important, being aware of the diverse complexity that Nantucket has, and being aware of the needs of all aspects of our community. So just wanted to take a few seconds to introduce myself. You've got my resume and application, it would be my honor to serve on the Commission for Human Services, having volunteer. I'm a regular volunteer at the food pantry in town and also at the vaccination clinic. And I would just like to be able to give back to the community in whatever way that I can. So thank you very much, and have a good evening.
Thank you, Veronica.
Okay.
Was there anyone else who applied for Council for Human Services like to speak? Okay, Sally Ann.
There we go. Most of you know me, but I just kind of wanted to reintroduce myself, and I kind of have a twofold interest in being on this council. One, I'm in the recovery community, and I think it would be nice to have the recovery community kind of represented. And I'm also very active in the seniors and elder community. I do a lot of volunteer work with Our Island Home. I'm on the board for NCEA. Very happy to hear that the Island Home is kind of moving along right now. That makes me happy. I also do in-home services for the elderly. I'm a Nantucket native, multi-generational native, graduate from Nantucket High School. And my grandmother was on the Silverhead legislature. And I think that being an elder advocate was ingrained in me very early on in life through her. I do tend to find myself leaning towards the elder community and their needs. And that's really all I have to say tonight. Thanks.
Thank you, Sally Ann. Is there anybody else out there I'd like to speak? I'll wait one more second here, but while just a reminder that when Attorney General weighs in on what was passed at town meeting, that we'll go from 7 to 9 members of the Council for Human Services. So whether that's September or November, no one's really said a definite date. I don't think we know, but there will be 2 more seats available down the road. Is that right, Libby? Or Erica? Yeah, okay. All right, let's start. Colin Ferguson. Go ahead.
All right, can you guys hear me?
Yeah, go ahead, Colin.
All right, yeah, sorry, my connection's a little iffy. All right, my name's Colin Ferguson. I'm 19. I've been a Nantucket resident for a couple of years now, but I've been coming here pretty much my whole life. I'm really interested in this because I thought this would kind of be my way of giving back to the community in Nantucket, which has given a lot to me so far. And I was hoping to kind of give a lot of different insight from my perspective, a perspective of somebody that's like under 30. What I want to add is greater insight and viewpoints into the board or the Council of Human Services, because I feel like a lot of people, especially in my age group, are underrepresented, and I'm hoping to change that. I've done a year of ROTC thus far at Boston University, and that's really helped with me learning to plan and organize the long term, and I'm hoping I can apply those skills to the committee.
Thank you, Colin. We appreciate your application. Okay. I don't see any other hands, so are we ready for a vote? Board members, Erica, you ready?
Yeah, are you gonna just do them after every section?
I think so. I'd rather do them one at a time than move on.
Okay.
Is that
So
okay with the board?
the process that we're going to follow, just so everybody knows, is you are going to each email me 2 names. And I will, once I receive your email with your vote, I will read them. You will confirm your vote, and then we will tally the votes to see who has the most.
Thank you. As Eric is tallying these up, I just want to say thank you for everyone for applying. I mean, Council on Human Services for years just didn't have a lot of people applying, and now it's the opposite. We're on the other side where so many people who are applying. I don't know if that's just because of the pandemic or the talent bank, or people just in general are giving back more, but it's really a great problem to have multiple applicants for over the seats. So thank you for everyone and everyone who worked in the talent bank and who's kind of getting the word out that public services is something that's worthwhile and valuable.
Okay, so the votes are Chair Bridges voted for Athlon Sweeney and Ruth Tonico. Miss Ferrantella voted for Sally Ann Austin and Colin Ferguson. Ms. Holgate voted for Athlon Sweeney and Veronica Bolchik. Mr. Fee voted for Sally Ann Austin and Veronica Bolchik. And Ms. Murphy voted for Athlon Sweeney and Ruth Tonico. Did I get all that right?
You had mine incorrect. I voted for Ruth and Colin.
Sorry. Oh, did I say it wrong? I have it right here on my thing. Ruth and Colin. Okay. So Athlon Sweeney received 3 votes. Ruth received 3 votes. Sally Ann received 1. Colin received 1, and Veronica received 2. So our 2 new members are Athlon Sweeney and Ruth Tonico.
Congratulations. Thank you, everyone. And just another reminder, in a couple months, we should go through this process again for 2 more seats. We'll go from 7 to 9. So hopefully everybody will apply again. Eric, we'll have to go through the same process, right? Yeah, okay. All right, thanks everyone. Cultural Council, we have 2 seats available and 4 applicants. We're going to do the same thing. I'll read the names and they can raise their hands if they like. Ava Rollins, Philip Santarelli, Sarah Ellis, and Kathy Melrod. There's Ava.
Hi there. I saw there was a dearth on the council, and I've always wanted to be more involved in public service on a local level. Probably dates back to walking by Millie in awe as a little kid out in Matticat in the 80s. And then my father and grandfather's involvement on a state and national level. I've handled arts and culture, tourism, public relations for international and domestic tourist destinations for the last 15 years. My work handling PR for Vienna, Austria over the last 5 years is probably most applicable, supporting the up-leveling of arts resources, public green space, and communication for residents and visitors as tourism continues to rise exponentially and make the city the most livable city in the world, which is according to the Economist Intelligent Life Unit and the Mercer study, which is kind of used to develop corporate programs. So I'd say my focus is how to support and welcome conscious growth on the island while enhancing quality of life for all those affected by the touristic sector, which of course is everyone on Nantucket. And I'd also love to help fine tune the communication channels by which the council shares its work and mission, and mainly opportunities for engaging in cultural resources, like how do people find out about resources? How does Nantucket support and welcome artistic talent? You know, those kind of eccentrics and visionaries that make the island so incredibly special. And then how do we record and broadcast those increasingly precious narratives? Those would be my focus. So thank you for giving me the opportunity to speak. And I'm so appreciative for the work that all of you do.
Thank you. Is there anyone else who applied for the Cultural Council would like to speak? Oh, Sarah Ellis, there you are.
Thank you for allowing me to speak today. I wanted to express how eager I am to serve on the Cultural Council. I am personally indebted to the arts and culture of Nantucket, as I have lived here for the majority of my life. In looking to the past work of the council, I particularly appreciate their attention to making certain cultural events accessible to the elderly and the disabled. To my mind, one issue which might provide a future opportunity for even more cultural awareness here on island is the new mental health initiative and its focus on mind, body, and spirit. Certainly the arts are a part of those concepts. Overall, a positive sense of place and an appreciation of the arts and specific culture of Nantucket seems like a necessary component as we look towards recovery from the pandemic. I have volunteered with many local organizations, and I've really enjoyed the sense of community found throughout those experiences. That's all I have. Thank you very much.
Thank you, Sarah. Anyone else? Is Philip or Kathy here?
I don't see them in the list of attendees, so I think you can go to a vote.
Okay.
Erica, I'm sorry, I lost my page. Are we voting for one or two people for the discussion?
Two.
Two. Thank you.
Okay, so Ms. Ferrantella voted for Ava Rollins and Kathy Melrod. Chair Bridges voted for Ava Rollins and Sarah Ellis. Just confirm, please.
Yes.
Okay, thanks. Mr. Fee voted for Rollins and Ellis. Okay. Ms. Holgate, Rollins and Ellis. And Ms. Murphy, Rollins, and Santorelli. So Ava Rollins received 5 votes. Mr. Santorelli received 1. Sarah Ellis received 3 votes, and Kathy Melrod received 1. So our new Cultural Council members are Ava Rollins and Sarah Ellis.
Congratulations, and thank you, Erica. Moving on to the Nantucket Historical Commission alternate. We have 1 seat available and 5 applicants. Applicants are Susan Listerlock, Linda Williams, Ethan Griffin, Barbara Ann White, and Jerry Ferguson. Barbara White is there to speak. Hi, Barbara.
Hi, my name is Barbara White. I came here in 1971 to take a teaching job here. I'm now retired after 33 years of teaching. I got my master's in African American Studies at Boston University. I'm a Nantucket Historical Association Research Fellow, and I'm the author of 4 books on Nantucket history. The major one that told the story of the struggle to integrate the Nantucket public schools before the Civil War. I recently spoke at the Arthur Cooper plaque dedication. I'm on the Cemetery Commission, and I thought I would be a good match for this particular commission. That's it.
Thank you, Barbara. There's Ethan Griffin. Hi, Ethan.
Hi, can you guys hear me?
Yes, sir.
All right, thank you for the opportunity. My name is Ethan Griffin. I'm a practicing architect here on the island. I've been here year-round since '04, but I was fortunate to be able to come out most summers growing up. While I deal with kind of sort of residential and sort of commercial historical aspects of projects on the island, what appeals to me most about this commission is the opportunity to have some involvement in shaping kind of the larger infrastructure and general kind of development of the island. It seems like that's something that, to me certainly is important and something that really could use a lot more kind of professional aptitude. So I appreciate the consideration and I look forward to the opportunity of working with the rest of the commission. Thank you.
Thank you, Ethan. Jerry Ferguson. Hi, Jerry.
Hi. I don't think I'm probably the most qualified person to be on this group, considering the other two of the applicants already spoke. I'm not a seasonal resident. I'm not a year-round resident. The only thing that I would bring to the table, I think, is a fresh perspective of possibly what other areas of the country do for historical preservation. So I think either one of the other candidates would probably be better than me, but please know that I would be willing to serve in any way possible because I really like the island a lot and I am sad to see the struggles it is having. Thank you.
Thank you, Jerry. Is there any other applicants that'd like to speak?
Nope, the other two were able to attend tonight. So out of the 5 applicants, you are going to be voting for 1 person, please.
I feel this need to feel the silent void here each time Eric is counting.
Right. So Chair Bridges cast his vote for Ethan Griffin, and Ms. Ferrantella, Mr. Fee, Ms. Holgate, and Ms. Murphy all cast their votes for Mrs. White. So Barbara is the new member of the Nantucket Historical Commission.
Congratulations, Barbara. Thanks everybody for applying. We move on to the planning board alternate. We have 1 seat available, 3 applicants. Those applicants are David Callahan, Chad Alexander Kilvert, and Abby Camp. If any of those 3 applicants are here to speak, please raise your digital hand. There's Abby.
Can you hear me?
Yes, go ahead, Abby.
Oh, great. Hi. I've served on the Sconset Advisory Board for 6 years, and I am presently the vice chair in my 2nd term on the HDC. And while serving on the boards, I've often wondered how this application or development got passed. Examples like Old Farm Road near the Catholic Cemetery, Hedgebury, abutting the Quaker Cemetery, and recently the land behind the Mueller property on Prospect. So I really would like to be part of the process, the decision-making that the planning board has to make. And I think it's a very exciting position to be in. So I would like to be on the planning board very much. Thank you.
Thank you, Abby. Is David or Chad here with us, Erica? Oh, there's David. Okay. Go ahead, David. I don't know. Is he on?
He's not on yet. Sorry. It's
Okay.
I'm trying to allow him to talk and it's making me promote him to panelist. So I guess I will do that.
Jason, can I ask a quick process question?
Sure.
How do we treat, well, before we get to David, because we've got David had a late applicant and the next one has a late applicant coming up. How did we treat that last time and how are we treating that this time?
Erica?
So because they were late applicants, as was Athel and Sweeney for the Council for Human Services, we held onto their application and we re-advertised those seats. And so it was, they're in with the rest. But we held them from the first round because they missed that deadline. So we're going through the whole process each time, even if it's late.
Dawn?
Yeah, just they applied late last time, not this time. Just totally clear.
Right. And I just wanted to check, I wanted to double check that so that we are, being consistent. I'm glad to hear that. We may not have to put that they're late applicant because it's the last go round, but okay.
Sorry, yeah, I should have taken that out, that part of it.
Yeah. Go ahead, David.
I'm running for planning board because, and thank you for the opportunity to speak. I'm running for planning board because I've been there for quite a while. I enjoy it. I think I have some knowledge there. I've been a full member. I've been an alternate, running for an alternate again. And I think I've learned a lot in the probably 10 years I've been there. And I know what the rules are that we have to live by. So that's something I'm not coming in to ask new questions. I understand what the planning board is up against. We have to approve some applications that might not be popular because they fit the scheme of what the town has. And I'd love to be reappointed. Thank you.
Thank you, David. Okay, I don't see any other hands raised. I think we're ready for a vote.
And you are voting for one member.
Yep. One member. This is the part where Madam Moderator always has a awesome story to tell in the town meeting
Have to do the
situation.
tally.
Right. Next year we'll have Sarah Alger come on and just tell stories during this time.
Okay, Melissa voted for David Callahan. Dawn voted for David Callahan. Jason voted for David Callahan. Christy voted for Chad Kilbert. And Matt voted for Abby Camp. So 3 votes for Callahan, 1 for Kilbert, and 1 for Camp. David Callahan is reappointed.
Congratulations, David. Thanks everybody for applying.
Thank you.
On to the Tree Advisory Committee. We have 1 seat available and 2 applicants, Ben Shampoo and Stephen Williams. I see Stephen Williams here. If you'd like to speak, you don't have to. Oh, there you are. Go ahead, Stephen.
Hi, everyone. Thank you for giving me the opportunity to speak on my behalf here. A little bit about myself. Stephen Williams. I'm 29. I began coming out to the island in 2015 and moved here year-round in 2017. From 2015 to 2020, I worked at Surfing Hydrangea Nursery, accumulating a pretty extensive knowledge on plant material on island. And then this year I've taken that knowledge to the garden group and put it to practice in the field. I'm an International Society of Arboriculture certified arborist. And the reason I applied was just to potentially have the opportunity to use this knowledge towards some of the projects that the town deals with, and to give back to this this community as well. So thank you for your consideration.
Thanks, Stephen. I see Ben there, Ben Shampoo.
Hi there, can you guys hear me?
Yep, go ahead, Ben.
Hi, everybody. So thanks for hearing me tonight. I have been serving on the Tree Advisory Board for, I think it's the last 5 or so years. And I got my application into Erica late, so that's my fault for being in this position. But I would like to continue on the work we're doing. We're embarking on some really important work now with all the development pressure that we're seeing in town, and I feel we have a good board and a very good thing going. Some of my qualifications: I am, as Steve mentioned, also a International Society of Arboriculture certified arborist. I'm also, I believe, the only Massachusetts certified arborist on the island. There may be one more, but I'm not aware. I've been in the landscape business most of my life, and trees are really one of my big passions. So I'd like to continue serving on the board, and I hope that you'll see that my past work is worthy of a reappointment. Thanks.
Thank you, Ben. Matt, you had your hand up?
It's just a question for Ben, just while he's there.
Sure.
Depending on how the vote goes, Ben, do you guys operate kind of like BPAC, where if the public is there and they are interested in being involved, that you allow them? They don't vote, but they are allowed to be there. Is that how you do it?
Yeah, absolutely. Yeah. We have a lot of public discussion at our meetings, and a lot of good things come of it.
Yeah, because the reason I'm asking is if Stephen Williams isn't appointed, I would love to see him stay involved, or vice versa. If you're not appointed,
I tell you, I know. Yeah, and I know Steve from Surfing Hydrangea. I think he'd be a really great addition to the board. And if he doesn't get voted in this time, certainly we are always looking for guys like Steve to be on the board if I happen to be there again.
And there are 2 seats that are going to be up next year.
Okay.
To put that out there.
I think we're ready for a vote now. 1 seat available here.
Okay. Christy cast her vote for Stephen Williams, and Jason, Matt, Don, and Melissa all cast their votes for Ben Shampoo. So Ben is reappointed.
Congratulations, Ben. Thank you, Stephen. And like Matt said, BPAC, we had a lot of people who would show up who weren't voting members but would contribute and just couldn't vote, and that was always really helpful. Okay, moving on to Zoning Board of Appeals. We have 1 seat available and 3 applicants. Applicants are Lisa Allen, Abby Molina, and David Pumphrey.
I just want to note that I did receive an email from David Pumphrey, who said that he was in the meeting earlier, but he had another commitment and had to step away.
Okay, thank you, Erica. Yeah, Abby has her hand up.
Hi, everyone. Thank you for the opportunity to talk to you. Thanks for inviting us to the meeting. My name is Abby DeMolina. I'm a full-time resident. I've been a resident for the past year and a half, but I first came to Nantucket in high school. But part of the reason why I wanted to become part of the zoning board is I really, as echoing some of the experience I've heard from the other applicants, that community involvement and civic engagement is really important. And I think that it's a great way to get to know and be an active member of the community here in Nantucket. So that's the reason why I'd love to be a part of any board here, not just the zoning board, but specifically I have background in housing and zoning from working in my prior life and where I used to live, but what I do now is I work for Santander Bank and I'm a program manager, just to give a little background. And I also do currently volunteer here on Nantucket with the Athenaeum. I give financial literacy classes. But for zoning, I think what's really important is upholding the zoning bylaws, but at the same time, making sure you're working with the different housing applicants so that you're able to come to a reasonable solution for everyone the best way you can. So thanks again.
Thank you, Abby. We have Lisa Allen with her hand up.
Hi, everybody. Can you hear me okay? It's Elisa Allen, and most of you know me, but some don't. Little background, I've been involved in many aspects of development on the island since I moved here year-round in 1989. So yes, that's 32 years. And I worked for a builder for 10 years who taught me so much about construction on the island and development. But then I started my own business in 2004 till now, constructing new homes, doing historic renovations on the island, architectural design and consulting. I also do interior design. I just would like to share my knowledge and my ideas in a fair and logical manner to help the island evolve and grow in the best possible way. And I think I would help the community and add a voice or contribute a voice of reason. And I would look forward to serving the community. I served on the Cottage Hospital Board for 8 years and enjoyed that whole process and serving the community. So I thank you for the opportunity.
Thank you, Lisa. And we know David's not here, so I think we're ready for a vote. Just one vote.
Okay, this was a split vote. Elisa Allen received votes from Jason, Matt, and Melissa. Abby J. Molina received votes from Christy and Dawn. So it was 3-2 with Elisa getting that spot.
Congratulations, Elisa, and thank you, Abby and David, for applying. Moving over to the Zoning Board of Appeals alternate, we have 1 seat available and 2 applicants. We have Jeff Thayer and David Pumphrey.
Neither of them are on.
I'm sorry?
Neither of them are on, so you can go straight to a vote.
Okay, thank you, Erica.
Okay. Jason, Matt, Don, and Melissa all voted for incumbent Jeff Thayer, and Christy voted for David Pumphrey. Jeff Thayer gets that seat.
Okay, thank you, everyone. That was really nice to see all the applicants. It's well worth our time to go through this all and listen to everyone. We're really lucky to have more people applying this year. So thank you. Anything else, Erica, on this?
No, but I would say I feel like the biggest outcome from our new process is all the extra advertising, and it really has increased the numbers of applicants coming forward. So I think that's a great thing.
Thank you, Erica.
I was just going to add, I really liked the talent bank and the questions that were asked there. It was nice to see how people heard about the town committees and the appointment process. So there was a lot of different answers to that. I just thought it was really nice to see kind of how people are getting their news and how they're getting involved with the town.
Thank you, Christy. Okay, we have 8 public hearings. So we're in that section of our meeting. So the first public hearing is to consider taking a portion of North Road, Seasconset. Ken, are you walking us through that? We're going to open that public hearing.
That actually is a motion to defer until the end of September because the parties have not been able to come to agreement on that. So that's an easy one.
Thank you. Didn't see that at the bottom.
Can I make a request to continue to September 29th?
You mean a motion?
That was a motion to continue to September 29th.
Don seconded. All those in favor, Melissa Murphy? Christy Ferrantella, that was a yes from Melissa.
Aye.
Matt B.
It kind of has to be roll call, so.
Okay, so Melissa, can you say yes again? I didn't hear you. Don Holgate?
Aye.
Melissa?
I have a hard time with my microphone without my ear pods in.
I heard you.
Yes.
Yes, I heard you there. Thank you. And aye, that is continued to September 29th. That passes unanimously.
And sorry about that. I just don't want somebody to, submit a complaint that we're not following the rule.
Sure.
And before you start number 2, Jason, I'm going to recuse on this again. Thank you.
Sure. Thanks, Matt. All right, so we're it's continued. Reopen this public hearing. Consider application new mobile food unit for Snick Snack LLC. Krista Lewis, the manager. Amy, do you want to just give us an overview? Kind of just remind us where we're at.
Yeah, absolutely. And I want to try to expedite the conversation a bit. I think we combined 2 things last time and can separate it a little bit this time. So just quickly, as you mentioned, it's a mobile food unit application with Snick Snack LLC that was continued from August 4th, I believe, discussion. As we recall, we got into a discussion about the location and being close to other restaurants. I want to separate that discussion from the actual license itself. I want to have that a separate conversation because the license itself can be issued regardless of that location or decision. Just like we do in other licenses, you can approve a license with the conditions for final inspections like we do with liquor and entertainment and everything else. They have met the requirements up to this point, right? They have the food plan with health was approved. Chief Pittman signed off on the hawker and peddler license for the state. They have their commercial kitchen at Fairgrounds Road, which is approved, their overnight parking, and all of that. So that for the license itself, my recommendation can be approved for the license itself. I know they mentioned that they weren't interested in, private events or catering, but that could change. That's something that is allowed regardless with this license for a mobile food unit. So if that came up, they would be able to do that. And then secondly, I understand, and I got an email from health that once this gets approved, tonight as far as the license. They've already talked to health, and health responded today to Mr. Lewis about the requirements for the final inspection prior to opening. So he has those standards and mobile food establishment standards per the state health code. And John Hedden had outlined all of that. So basically, that's one vote, is discussing the license. They've met the requirements, approving the license with the condition that the license will be issued upon final inspections and receiving the health permit. And also, as John mentioned, determining the wastewater, disposing of the wastewater, which is a $10 sewer permit, but it just needs to be indicated per regulation. So those things can be done. So that's one decision that I think is clear. And the second, and once I'm done here, they can certainly give us an update on that. The second is location. The one that caught us up last time was at Nantucket Bank, because per our requirements, it shouldn't be within 500 feet of an established brick and mortar location for food service, unless there is some sort of agreement or exception that would qualify. Separate from that, they can also work on a parallel path for locations. We do that all the time. This week, a previously approved mobile food unit got an opportunity for another location on private property. That property reached out to us, gave written approval, and it's not near anything else. So that does happen, and they can work on that as a parallel path. That hopefully makes sense to what I'm saying here as well. So you have that one discussion on the license. Second, we can discuss that location if still valid for them. We did receive a comment from the Boathouse, who may be on tonight. I'm not sure, about some concerns about a mobile food unit in an area. But again, this is part of a local regulation. The select board in their purview can determine an exception or a situation that they can't allow it in this location. Secondly, I'll also say for mobile food units, unlike when you have a brick and mortar or a liquor establishment, it's a location that obviously can change year to year. I worry about precedents sometimes because it opens it up if you make exceptions, but the mobile units, again, and next year is going to change a lot. I think we're going to try to tighten this up for folks, but it's most likely, since we're still in the world of exceptions and COVID, is a approval for this year. Okay, things turn over for each year. So if we, get into that part of the conversation, don't get caught up in that too much. Just determine what's best for this moment in time for this year. And the renewal process they'll have opportunities for other locations again as we renew for 2022. So hopefully that clarifies the two paths and two discussions you have this evening.
Thanks,
any
Amy.
questions? If not,
yeah, I think how's the board feel on the first part? Just the license that we do, similar with a liquor license, it has to get all the other approvals from all the departments, and where are we at with that? Chrissy, Melissa?
Yeah, I feel very comfortable with their application meeting those requirements.
Okay, what's the motion? So I'm getting thumbs up. Is the motion just to approve the license with contingencies at all? What's the wording we need to use?
so approval of a mobile food unit license for Snick Snack LLC pending final inspections by the health department as required.
Anybody want to make
So
that motion?
moved.
Okay.
I'm sorry, the public hearing is open and you haven't asked for public comment.
Oh, right.
Good call. All right. Is there anybody from the public that'd like to speak? Thank you, Erica. Always keeping us on the ball. Mr. Lewis, I don't see any hands up. There's gonna be more time to talk if you want after the license, but did you want to say anything, Mr. Lewis or Krista? You go ahead.
Do we talk now or after?
Yeah, you can right now if you want. Sure.
We had tried with the two of the abutters that were within 500 feet of 104 Pleasant Street. One was Glidden's and one was the Boathouse. And they did not sign off. We did have a verbal conversation with EJ Harvey. Sea Grill, but we have not gotten anything in writing. He did say with him, it would be okay anytime before 4 o'clock, because that's when they open, and all day Sunday.
Yeah.
What's the
Okay.
requirement for,
Anything else from the public or? Sorry, I have a bad internet connection. Sorry.
So I'm confused. Usually we, sorry, let me put my video on. Usually we close the public hearing and then do the motions, but you're saying that there's gonna potentially be 2 motions? Is that right?
I can respond, and I might have, maybe I expedited the conversation a little there at this hour, but I said there's 2 different discussions. I didn't want their license to get tied up in the discussion about the location that is. So I was trying to separate the 2 discussions, saying that the license can be issued regardless. I mean, they can do it all in one and then do 2 motions. They would have to make a motion for an exception to the 500-foot rule if they see that would be okay. But I want the license to be its own vote and own section, if that makes sense.
All right, so we still have to close the public hearing and make the motions when we're ready. Any other comments, questions from the board?
I'm sorry, Jason, comments or questions on number 1 or on number 2, the location? Doesn't
Either
matter.
one. Once we close the
Okay.
public hearing, we'll be voting on both.
Okay.
Or the first one.
Okay. I really don't want the conversation about the location to prohibit us permitting them from having the license to operate the mobile food unit. I do have some concerns around the location if the neighbors do have some concerns, but I think that that's nothing that can't be worked out. So, I think I'm very hopeful that you can find a location that gives you the distance you need to not compete in the way that the policy is set up. But I really do want to make sure that we can give them the approval of the license so that they have the flexibility to get to work as soon as possible if other opportunities open up.
Thank you, Melissa. Any other board member comments? I don't see any hands up from the public. Christy?
Thank you. I was just going to say, I agree with Melissa. I don't think the license should be held up, but I'm not in favor of kind of giving that waiver of the 500 feet unless all the neighbors are in agreement. So I just would want that to be part of whether it's written with Amy that all the neighbors agree with it within 500 feet.
Yeah, I'm supportive of the license as well. Melissa?
And just a comment, which, I don't know, certainly I don't know the conversations the Lewises have had with each of the people, but, or each of the businesses, but just based on the hours proposed, they do run a little interference. I can see with the, right, but I was going to say, if you're flexible, if the Lewises are flexible with that, then I think that there's a lot of actually complement, particularly with the breakfast offerings for this neighborhood. So, I think that they've designed a program that can be flexible.
Okay. Any other comments before we close the public hearing? Once we close the public hearing, the select board will take a vote, and then that should be it. Once we close the public hearing, select board could still discuss things, but the public won't be allowed to speak. So that's why I want to give everybody a chance to say any last words or comments. Okay, we'll close the public hearing. It's the pleasure of the board.
I'll go ahead and make the motion as worded by Amy earlier.
Second.
Okay, any other discussion? Okay, all those in favor by roll call. Don Holgate.
Aye.
Melissa Murphy.
Aye.
Christy Ferrantella,
Aye.
Jason Bridges, aye. So that passes 4-0, and that is for the license.
Thank
Right.
you.
And there was no policy change on the 500 feet. So that's kind of, we wish you the best of luck, and I think we all think you can work it out with a little more conversation. And
Yep.
No Amy.
I just wanted to add, if I could, on the locations too. And if it doesn't, this is a tough location, that Nantucket Bank. It's similar to downtown where it's in a very heavy area with other restaurants, but other types of locations we can put on the license as you go. Like I said, we've had something this week where someone came up with something, and I'll say it's out at Act Natural that isn't near anything else that the property owner requested, right? So if you work through that, we can certainly add that to the license. Just notify us with that in writing, and we can certainly do that along the way. So we won't have to go through this process for things that don't bump up against the current regulations.
We also reached out to the Richmond group this week,
Okay.
Based on speaking to Erica. So I haven't heard anything back from them.
Okay. Well, that's a possibility. They've certainly set up for that. So just as you go along the way, again, this was done because of that restriction that we have in the regulations. Other things we can handle on an administrative basis moving forward. Okay.
Okay.
All right.
All right. Thanks, everyone. Good luck. Hope to see you out
Good
there.
luck.
Do I blow kisses now or later?
Thank you.
This one for you,
Second out.
Libby.
Good night. Thank you.
Thank You got 1 point. Thank you.
Okay, so next public hearing, we'll open the public hearing to consider amending chapter 250 of the harbor. Okay, sorry, we are going to continue this.
Motion to continue to October 6th. What do you think about that date?
Yep.
Agreed.
me.
Second.
Second by Melissa Murphy. All those in favor by roll call. Matt Fee,
Aye.
Christy Ferrantella,
Aye.
Melissa Murphy,
Aye.
Don Holgate,
Aye.
Jason Bridges, aye. That's been continued.
I just wanted to add that appreciation to you, Jason, Christy, and to Don for recommending postponing this vote and getting a little bit more constituent buy-in on it. I think that they made great strides in the edits based on the conversation we had a few weeks ago, and I think it's only going to get better. So thank you for your leadership on that.
Thank you, Melissa. I will pass all that compliments over to Dawn. That was her suggestion. Thank you, Dawn. Okay, open a public hearing to consider utility petition from National Grid. This is for 34 Fairgrounds Road. I think we've got Fabio here, I think, to walk us through this.
Hello, can you hear me?
Hey, yeah, we can hear you.
Awesome. Yeah, which one are you guys starting with?
This is 34. This is number 4 on the agenda. 34 Fairgrounds Road.
The fairgrounds?
Yep.
Okay, I see it right there. Yeah, that's for a customer connection for a new house of fairgrounds. The handhold is beyond the bike path well into the public way. And we just want to get the rights to connect that house to the handhold and have the customer be able to dig to it.
Did you say
the house is already up and it's eager to get power?
Fabio, did you say that's in the, it's on the bike path, or just has to go under the bike path, or what did, next to it?
Under.
Yeah, sorry for if my cell connection is terrible. It's on the grassy area adjacent to the pole. They have to dig under the bike path to get to it.
Okay.
And can I just add that this is for the house that was moved from the now land bank former Mrs. Hayes property, and they're pretty much ready.
Okay. Any questions? Or this is a public hearing. Is there any comments? Right from the public? I don't see any comments from members. All right, we'll close the public hearing. It's a pleasure of the board.
Move approval with the recommendations that are in the packet.
Second.
Second by Melissa. All those in favor by roll call. Don Holgate. Sorry, I didn't hear you, Don. Did you?
Aye.
All right. Matt Fee,
Aye.
Melissa Murphy,
Aye.
Christy Ferrantella, sorry.
Aye.
Jason Bridges, I'm trying to go too fast. That passes 5-0. Thank you. We'll open the next public hearing for utility petition. This one's on 23 Vestal Street.
Yes, so this one is for a new house that's being built at 21B. So the handhole location that's existing, that's the nearest secondary connection location that we have is at the base of that pole. So we like to trench with secondary cables, National Grid owned, along that side of the street and cross over to a handhole. And then the customer can just tie in at that new handhole closer to his property.
When you say trench, is that you tearing up the asphalt, or does it go under the road?
Yeah. That's we'll be cutting that the typical trench and then repaving on top of that, making a patch.
Okay, this is a public hearing. Any comments from the public or the board? Okay, we'll close the public hearing. Is there a motion? Oh, sorry.
Approval?
Sorry, I just closed the public hearing, but I saw a hand go up. I don't know if that's for this agenda item. Erica, I'm assuming it's already closed the public hearing. I can't go back.
You should double check with Libby. I mean, maybe you could make a motion to reopen the public hearing, but I feel like it's closed.
Yeah, I think it's closed. Sorry, I waited a little bit, but maybe I didn't wait too long. Sorry, did somebody make a motion?
I moved approval.
Is there a second?
Second.
Thank you, Christy. All those in favor by roll call, Don Holgate,
Aye.
Matt Fee,
Aye.
Christy Ferrantella,
Aye.
Melissa Murphy,
Aye.
Jason Bridges, aye. Dorothy, I'm sorry, I might have went too fast there. That was my fault. My apologies. We'll open the public hearing. The next public hearing is a utility petition for a new handhold in front of 85 Tom Nevers Road.
Yeah, so this one is a similar situation, a brand new house being built, and we have a pole across the street. We need to get secondary service to the house, and because we cannot go overhead, we like to go underground from the pole to a new handhole where the customer can bring his service to and get electricity.
Okay, this is a public hearing. Is there any comments from the board or from the public? I will wait a little longer this time. Okay, seeing none, I'll close the public hearing. Pleasure of the board.
Motion to approve with conditions
Second.
or comments.
Second by Matt. All those in favor by roll call, Don Holgate. Matt Fee.
Aye.
Christy Ferrantella.
Aye.
Melissa Murphy.
Aye.
Jason Bridges, aye. That passes unanimously. We have another public hearing to consider joint utility petition for Verizon New England and National Grid. This is for Old South Road to move aerial cables to underground.
And we have Tom Stanton from representing Verizon.
Okay.
Good evening.
Hi there.
Hello.
Yeah, go ahead,
Can you hear
Tom.
me?
Yeah, we can hear you. Go
Yes.
ahead.
Verizon is asking to remove two aerial cables that currently cross Milestone Road to Old South Road. And the reason is that with the amount of house moves in the area, we're constantly taking these two cables down, and it's causing a lot of stress on these two poles. So we'd like to go underground, trench to about 80 feet up Milestone Road, and then dig two splice pits on either side of Milestone, because we're pretty sure we have existing conduits under Milestone Road. And we could hook up there and then trench the rest of the way to pole 175 over 1 Old South Road.
Thank you, Tom. So if the conduit's already, you're saying it's underneath Milestone Road, so you won't have to dig it up?
Yes, correct.
Okay, that's helpful. just for traffic and just beating up the road.
Yes.
Any comments from the public, from board members? Matt, then Don.
Yeah, I think this is great. It's something we've been asking about for 10 years. I'm kind of shocked there's a conduit, and I thank you for doing this. This is amazing. And
Can I ask you a question? Can I ask a question? If we can't find the conduits, can we still continue with the project?
Erica, you have a funny look on your face. Dawn, you have a hand up? Go ahead.
I mean, I would say how can we go wrong getting wires underground? Isn't that what our goal is? And I think do it however you can with returning things to their proper condition.
Yeah, it seems like that'd be a bigger project, right?
Obviously,
yeah.
And I think then we have scheduling issues and timing issues. When's the time to do it? You know, I think it's then we may have a different conversation, right?
Yeah. If the road does have to be dug up, does that have to come back here? It seems like it's a different type of project. No?
Can I speak on that? I mean, the application is for, it doesn't talk about that there's conduits already in the road. When Tom said that, I was actually surprised because the map clearly states that they're putting in conduit. So it shouldn't have to come back. But obviously it's going to have to be reviewed by all the local utility companies. There's going to have to be markouts. DigSafe's going to have to be involved, and it's going to have to be coordinated through the police department in this office to make sure that we don't have something like a modular move or, something big going on in the rotary when it's scheduled.
Yeah. Okay. Can we go to Billy Cassidy?
Mr. Chairman, I'm wondering why directional drilling or mole.
Oh, sorry. I just accidentally shut him off. Sorry, Bill.
I got that. I'm just wondering why directional drilling or mole use isn't being considered with any of these. In other words, tunneling. It's pretty easy. We have the ability to do it on the island with a couple of different vendors. And when you get into the directional drills, I think there's actually even a couple of those on the island, and it's pretty painless.
You answer that, Tom?
Well, we need to have our cables in conduit. They can't be direct buried. So that's the reason we're going to dig. Directional boring is good for going under roads and driveways, but for placing cable in a area that's exposed and not covered with asphalt, that's why we put conduit in the ground.
Erica?
I just want to note a couple things. The DPW typically requires conduit encased in concrete for that reason. I would also note that the police department requested one additional 2-inch conduit for municipal use for fiber optic to be installed during this project, and Verizon has agreed to that. And this work will require state permitting. So in addition to working with the town, they're going to have to get permission to cut open the state road.
Okay.
Yes, that's in progress right now, Erica. Is there a time you'd like this project put off till? Working on the rotary.
I mean, do you have a proposed timeline?
Do I?
Well, does Verizon, in terms of when they're hoping to get this done?
It's not an emergency, let's put it that way. So if you want to wait till after the summer season, obviously that would be.
Yeah.
Yeah.
I think, Chair Bridges, I think that the timing of it is something that we can discuss with Verizon offline to make sure that, we want to get the job done, but we want to make sure that there's not too many conflicts with this. Obviously, it's going to impact any traffic through that roadway. But, you know, we'll deal with that.
Yeah, after Labor Day for sure. All right, any other comments from board members or the public? Seeing none, we'll close the public hearing. Pleasure of the board.
I'll make a motion to approve it based on working with staff to find the right time and to make sure that the other concerns are addressed.
Second.
Seconded by Christie. All those in favor by roll call. Don Holgate.
Aye.
Matt Fee.
Aye.
Christie Ferrantella.
Aye.
Melissa Murphy.
Aye.
Jason Bridges, aye. That passes unanimously. Thank you, Tom. Thank you, Fabio, on that one. We have one more, number 8. We have the public hearing to consider a joint utility petition from Verizon and National Grid on Shell Street to move aerial cables underground.
Yes, this is a customer request to remove 2 poles, pole 239 over 1 and 2 on King Street, and run conduit from pole 32 over 9 Shell Street to pole 239 over 3 King Street.
Okay.
And this is a project that we could mole under King Street, you know, so we wouldn't cut the street.
I think anytime that we can not cut the street is great.
Yeah,
for
absolutely.
future potholes, for bikes, for just everything. So that's good to hear, Tom. Can we go to the public? We have Ed. Go ahead, Ed.
Having us here with you. Just had a question about the where residences of 20 Center Street, which is directly adjacent to the property that you're looking at, and just was wondering what the extra loads that might be on the pole that directly faces our property, and then secondly, whether or not we can also send the conduit over to that pole on Shell Street and bury that underground as well.
This project is only from pole 9 on Shell Street to
Eric,
King
can you pull it
Street.
back up? Sorry, Tom, I just want Erica to pull it back up so we can see what you guys are talking about. Go ahead, Tom, sorry.
I'm looking for the address where the gentleman's concerned. You were at 20?
20 Center, yes.
Yeah. Oh, okay. Well, no, that pole is staying. Pole 32 over 9.
Yeah, so our concern is just the extra load that's going to be on that pole, and just, there's going to be just a question of what electric or otherwise utilities that might be going to that pole, which is directly next to our property.
Yes, I understand. The load is going to be less on that pole because you don't have an aerial cable going down King Street now. It'll be buried. So that extra load, that load of pulling that pole toward King Street will be gone.
Does that answer one of your questions, Ed?
It does, and I guess the secondary question would be, would it be possible to also send that pole into like a handhold type of implementation?
No, sir, because you have aerial cables going down Shell Street.
Okay. Gotcha. Okay, thank you.
You're welcome.
Thanks, Ed. Thanks, Erica. Any other comments from the board or the public? Not seeing any, we'll close the public hearing. Is there a motion?
Move approval.
seconded by Don. All those in favor by roll call, Melissa Murphy,
Aye.
Christy Ferrantella,
Aye.
Matt Fee,
Aye.
Tom Holgate,
Aye.
Jason Bridges, aye. That passes unanimously. That concludes our public hearings for the evening. Libby, over to you for town manager's report.
Thank you. We've got fourth quarter end of year budget reports for fiscal 21. And we will start with the general fund, and the Director of Municipal Finance, Brian Tarbett, will take us through.
Thank you, Erica. Thank you, Erica. Perfect. So I think as we had talked through the first 3 quarters, when we did the budget back in 2020 for fiscal 21, we were not exactly sure what was going to happen with COVID. So we made some substantial changes to some revenue accounts, which, as everybody's well aware, significantly outperformed our expectations. Rooms and meals tax, or rooms tax being one of them. Meals tax, we actually zeroed out because we weren't really sure what, whether it was going to be in-person dining and how that was going to play out. So rooms tax or meals tax, excuse me, certainly also outperformed expectations. Building fees, HDC filing fees, permits also significantly outperformed our expectations over the course of the 12-month period, which generated an excess revenue figure of almost $12 million, which I know seems very large given where we were expecting to start. One caution that I would like to mention is that a lot of this increase that we have experienced this year has already been built back into the budget for fiscal 22. So it's not something that we're going to see on a year-over-year basis. Specifically rooms tax, we collected about $7.4 million. We have used approximately $7 million of that in the 22 budget. So this really is a one-time event that has occurred and will contribute to an increase in free cash. But again, I want to stress to everybody that this significant increase in revenue is really a one-time event based on how we expected 21 to unfold. And I don't ever expect us to reach $12 million over budget again. On the expense side, we came in at about 97% of the annual budget was spent. That's through a lot of the hard work and diligence of the departments, especially near year end. They worked very hard with our department to make sure that we had encumbered only the POs necessary for year end expenses. The school also did a tremendous job working with us as well. Some of the unspent money and salaries is attributed to some of the delays and the slowdown in hiring that we had experienced and still do experience in terms of filling some open positions. Erica, could you go to the next couple slides, please? This just is a graph of where the revenues broke down and how they came in over the year and comparing it to the last 5 years, excuse me, starting in 17. Go to the next slide, Erica. Perfect. So this is general fund revenues on the 12-month basis. As you can see at the bottom, we brought in almost 111 million. The budget was 99.4 million. So it's almost a 12 million. It's just about a $12 million increase. Again, I caution everybody, not only on the select board, but anyone listening, we won't ever see $12 million above budget revenue. And I don't ever expect to see that again. I think this was specifically attributable to the pandemic and where we thought when we were budgeting this was going to be. It is excellent performance, but certainly I think a one-time event. Can you go to the expense side, Erica? Next 2 slides down to the year-end results. Perfect. So as you can see here, the budget was $101 million. We had total general fund expenses expected of 90 in the year of 98.4. So again, I just want to note that this was really a function of the departments really working hard in managing the expenses. Some of it is attributable to delays in hiring and open positions that were unfilled at the year end, which certainly we're working to fill some of those as we move into fiscal 22. Next slide, please. In this slide, we actually have put pretty much all the top 15 capital projects across all the spectrums. The Affordable Housing Trust Fund was very ambitious in acquiring properties and moving in trying to execute their strategy, and not only in neighborhood first, but also in the CPC bond that was authorized for land acquisition. The airport had some significant capital projects that they undertook in fiscal 21, along with sewer, and want to comment with some installation of sewer mains. Next slide, please. We had recently done a large borrowing, still AAA with Moody's. We expect that will be continued to be reaffirmed. And we do expect at some point in probably the next 6 to 9 months that we will get a surveillance request from Standard & Poor's, with the hope that they'll see the progress that we made from their last visit and potentially upgrade us as well. Next slide, please. As always, we give a brief kind of overview of what happened during the quarter for the investments from our investment advisor, Morgan Stanley, and a list of the fees. We do a rebalancing of this every 6 months. They most recently rebalanced some of it as of June or July 1st. So overall, they've done a fairly good job with managing that, and the treasurer works very diligently with them on a 12-month basis. Next slide. Please, Erica. Thank you. Really, the only red here is in the local receipts is on the meals tax, and that's partially because of where we had budgeted and some partially related to the pandemic. We do expect that this will certainly turn into yellow or green in the coming fiscal year. So here, there's not a tremendous amount of concern right now from me in looking at the Muni Watch. I think that's it, Erica, if I'm not mistaken. So I'll certainly, if the board has any questions, I'll certainly be happy to try to answer them for you.
Any questions or thoughts? Nice work, Brian.
Thank you.
Thank you.
All right, next we've got Our Island Home, and I think the administrator, Chris Roberts will take us through with possible assistance from Brian.
Hi, everybody. So like other people have stated, COVID kind of threw our expenses and revenue into a bit of flux that we don't anticipate to see routinely going over. Thankfully, Brian, I believe I left my notes at the facility, unfortunately, but I know we were $1 million. We had a bit of we didn't hit quite as many as expenses as we had anticipated this year. We were about $1 million under. And a lot of that has to do with some extra funding, as well as extra resources that we did receive from the state and federal level that we won't get in the future. And also our revenue was down a little bit also due to COVID. Essentially, COVID made our building go from a 45 possible census to a 41, just because it was best practice to hold at least a few rooms open, just in case, God forbid, there is an outbreak. As someone who had an outbreak in a full building, that is the best practice to do. So kudos for doing that. But that did obviously, like I said, it gives us less chance for revenue because there's less beds we can put into service. In addition, a lot of the revenue source this year came from Medicaid mostly, or Medicare. For those who don't know, Medicaid usually pays for your long-term residents, and they pay at a significantly lower rate than Medicare. Medicare is for your short-term rehab, so people who had a slip and fall and need help with gait balance, someone who had a hip surgery and needs that, extra therapy before they go home. Medicare will pay for their stay up to 100 days, and that's usually at about a rate of, on average, $500 to $600 a day. Being as the amount of admissions was significantly down, especially short-term admissions this last year due to COVID, just the referrals overall were down. That did hit the revenue. The plan is going forward as hopefully we start to come out of this. We will definitely be able to big push on getting and holding our census at that 39 budget level that has been set. And my hope is to go above that 39 budget level going forward to kind of hopefully recoup a little bit of what was missed this year going forward. Right?
Yeah, Mr. Chair, I'd just like to point out that on an overall basis, we were, as the report notes, about 58% up over the previous fiscal year. The entire driver of that was relative to the fact that we received 2 years of certified public expenditures. So when we look at it, Chris and I did talk about the fact that the revenues that actually, the usage revenues were down, which, as he mentioned, was we feel mostly related to the impact of COVID-19. So I just want to make that note. So it was certainly positive that we received the 2 years of CPE, which is certainly helpful moving on a go-forward basis for their certified retained earnings and being able to fund some capital expenses over the coming time in that gap between hopefully moving into a new facility. Just want to make sure everybody was clear on that, because this does point out that we were up about 58%, which, if you look at the report, really only highlight is driven by that CPE number.
Thank you for clarifying. I thought it was, some of it was from CARES Act. I just assumed $1 million over would be connected to CARES.
All the CARES Act funding, as per the Treasury guidance, is required to be held individually in separate funds and not put into, i.e. either the general fund or, in this case, into the enterprise fund directly. So that's where those were all held.
Thanks.
Anyone have any questions for me or anything that I could answer?
No questions for me. It's a long meeting, Chris. Thanks for sticking in there.
Oh, no problem. I ate my dinner while I was waiting. No worries. Thank you.
Okay, airport is going to be continued to September 8th. And I think Brian's going to take us to the solid waste enterprise fund. Thanks, Brian.
I will. Thank you, Libby, and thank you, Mr. Chair. Overall, the enterprise fund, on the revenue side, we were down about 100,000, a little over 100,000 versus what we had projected. Normally, I would be extremely concerned, but I think that I think some of it is DPW and I have been working on the outstanding AR list that exists. It's not horribly substantial, but there is some outstanding accounts receivable that we could collect from the billings that I think would account for that difference. So that's something that we've been focusing on. So overall, I'm not entirely overly concerned about that small miss in the revenue. I think if it was substantially larger, I think we would be having a different conversation, but I think it's something that moving into next year, into fiscal 22, I think that we certainly can overcome. The expenses certainly also helped by, again, with the department, also with our consultant and working through and combing through the expenses. Those did come in under budget, so that certainly protects us from any shortfalls, so we don't have to worry about that. Overall, I think solid waste performed reasonably well, and I think is in a position to move forward in a meaningful way into fiscal 22, and I don't have any major concerns with the way the year ended for them.
Thank you, Brian. Any questions? Comments? Okay. Thank you, Brian, you and your team.
Thank you
for those reports. They're really nice and they're helpful.
Thank you very much.
Thank you very much, Brian. Next is the monthly town management activity report. And I don't usually go through the, every single item here, just some of the highlights. So to do that, under the plans, reports, and studies category, we are working on an update to the board strategic plan as far as implementation activities go. And then we're hoping to schedule a check-in with the board in September. We've met with some folks in Nantucket on the Nantucket sewer project and the scope of work that our consultant Weston and Sampson is working on to update the potential cost of that project and routes, which since that project was initially envisioned, the route may need to change or be modified, or alternates may have to be proposed due to sea level rise and FEMA projections about sea level rise. The facilities master plan, we do have your workshop scheduled for tomorrow from 1 to 3:30 at the Fort Fairgrounds facility. And any members of the public who wish to attend are more than welcome, except remotely, please, not in person. Baxter Road long-term planning continues with the Arcadis project, and we hope that they will be providing an update to the board in early September, tentatively right now, September 8th. Need to do a check-in with them to see if that is still a valid date. PFAS, of course, is ongoing. It continues to take up a significant amount of staff time. We did have a listening session yesterday, which was facilitated. We probably had 45-ish people on a Zoom session where we heard about concerns and questions and comments, and I think it was a pretty decent session. Lots of meetings going on. Starting to think about 2022 annual town meeting. I need to get a timeline put together. I've not done that yet, but I've certainly got a file started for it. Fiscal 23 budget pre-prep, I'm calling this. We are actively working on that. I've got a meeting with some other staff people and the DPW staff, the interim director and a couple of others. We're meeting weekly right now, if not more frequently, to try to prioritize day-to-day operations and start getting a handle on projects. There is a Board of Health meeting tomorrow, I believe, and there was a Board of Health meeting last week or the week before about the orders. I'm trying to kind of keep track of that. We had the large-scale events workshop, which does necessitate some follow-up, which the licensing administrator will be working on. And hopefully by one of your meetings in September, toward the later part of the month, you will have some recommendations about outdoor dining and events and business licensing. Events are listed there. I've already reviewed the USS Nantucket with you, and some of us attended the Arthur Cooper Memorial. That was last Thursday, I think. Very well attended, and nice comments by the speakers that were there. Go down a bit, Erica. Just some other projects that we're working on are shown here. The ones that are taking a lot of time or will be include those ones in bold, SPF and SPPF and Baxter Road, of course, the DEI strategic plan. We're about to issue an RFP for the classification and compensation study that we budgeted for fiscal 22. We're working on a committee handbook update. And Erica's done a phenomenal job putting together the fall winter projects map and timeline. At some point, Erica, we probably should show that to the board just so people get a handle on all what's going on. It's getting refined all the time. We have a internal meeting on Friday with our facilitator, Julia Novak, who you all know, and will be facilitating the workshop tomorrow as to a sustainability function within town government. And eventually we'll bring you all a recommendation on that. A lot of personnel issues going on with vacancies. And to Matt's earlier point in the meeting, the HR does produce a regular vacancy report that's reviewed with the cabinet monthly, if not more frequently. We're happy to share that with the board. We've had a lot of internal discussion lately about recruitment and retention, and we'd be happy to have a discussion like that with the board. So happy to answer any questions.
This is more select board comments, but I met with land council a couple of weeks ago about stormwater, and they were very, nice. Like they understand with the pandemic and things got pushed to the side, but they hopefully, this year, this off season, next year, that we can kind of start getting back, putting stormwater back into the conversation. So
I forget if I put it on here or not, but I did have a recent meeting with health director and the natural resources director about stormwater regulations that we had been working on that had been kind of put on hold. So we are trying to get back to those. There are a number of stormwater projects that are in the queue as well, and they need a manager.
Yep.
And they don't have one right at this exact moment, but it's definitely something that we're trying to get to.
Yeah. Comments or questions for Libby? There's a lot of stuff going on.
That's it.
Okay. Thanks, Libby. Select board reports, comments, any committee reports? Matt?
Move to adjourn.
You didn't give Christie a second.
Quickly.
Christie always has something, but okay. Is there a second to adjourn?
Second.
All right. By roll call, Melissa Murphy. Christie Ferrantella.
Aye.
Matt Fee.
Aye.
Don Holgate.
Aye.
Some Bridges. Aye. That passes unanimously. Thanks, everyone. Bye. Thanks, Libby. Thank you, Erica.